Road Traffic Amendment Bill 2025.
Members' motion with no legislative effect. Dr. David Lam's motion on comprehensively promoting healthcare financing reform and making optimal use of public and private healthcare resources. 4 members will move amendments to the motion. This council will proceed to a joint debate on the motion and the amendments. Later, I will first call upon Dr. David Lam to speak and move the motion. Then I will call upon Mr. Edward Leung, Mr. Bill Tang, Dr. Hoey Simon Lee, and Mr. Pui-leung to speak in sequence, but they may not move the amendment at this stage. The joint debate now begins. Members who wish to speak, please press the request to speak button. Now call upon Dr. David Lam to speak and move the motion. President, I move that the motion as printed on the agenda be passed. Comprehensively promoting healthcare financing reform and making optimal use of public and private healthcare resources. On the 25th of March this year, the government announced the public healthcare fees and charges reform so as to adjust the fees and charges of various public healthcare services, and that limited resources will be directed towards those in financial need. There will be an expansion of the medical fee waiver system so as to provide more protection for those in need. There will also be an annual fee cap. As for the co-payment mechanism, this is for members of the public to stop and rethink and discuss with doctors, because diagnostic imaging may not be the best option in every circumstance. From the public's perspective, the A&E unit may have, the increase in A&E fees may pose a heavier burden on families. Now, the government should explain the situation to the public and help solve problems. One important point of my motion debate is to help the public cope with the fees and charges reform. Now, I have checked the Singapore's community health assistance scheme. This scheme targets family doctors and provision of dental services. Now, the essence of the scheme is that Singaporeans are well aware of the level of reduction in fees in advance, and that it comes in 5 tiers. For those earning 2,300 Singaporean dollars, they get the green card subsidy. They also have, say, the blue card and also the orange card in the middle. In Singapore, there are also 2 other types: Medicaid card for senior citizens and Pioneer Generation card, which provides a high level of subsidy. So Singaporeans can check the level of subsidy that they have online at any time for better assurance. The administration is invited to consider this model. The second point is that for preoperative scans for colorectal cancer, including pelvic scan and also MRI, altogether the fees could be 500 followed by 6 days of hospitalization, 1,800 for the low class. For the grassroots, this may be a very big sum for them. So I have 3 suggestions. First is to allow the use of MPF to pay for public healthcare expenses. Second, to allow for the healthcare voucher for the elderly to pay for the hospitalization and the co-payment fees. The third suggestion is built on the basis of the first 2. Now, people have little to rely on beyond retirement because of the MPF's accumulated balance. If they are required to pay for public health care expenses, they can't make ends meet. The original intention of elderly health care vouchers is for them to join primary health care as a prevention measure. It's not for hospitalization. And it's also against the co-payment model. A long-term policy should be devised. That's my third suggestion. Say, if I start working at the age of 25, if I save $50 per month, then by the age of 55, I will have $18,000. of course, we must make sure that this pool of money can catch up with inflation. $18,000 will be more than sufficient to pay for the hospital charges and the co-payment fees. Now, if the government is willing to set up a matching fund at the ratio of 1:1, then by the age of 55, this citizen will have $36,000 in its account. The third suggestion is this. The first 10-year hospital development plan is coming to a close. The second plan is due to begin. We're going to have more and more hospital beds to meet with future demand. According to the HA, on average, the cost per bed is $7,000 per day. So even if people are required to pay $300, that means it's just 50. It's less than 5%. The overall level of subsidization is still above 95%. We have a simple and low tax regime and high level of subsidization in public health care. We are unique around the world, but we should not be proud. Because we need optimal use of resources instead. So a reimbursement approach should be taken, built on the basis of voluntary health insurance. The subsidization level can go down from 95% to 50 or even 33%. And that patients using the service will be focused. We can focus on patients who are not planning to use private service anyway. So I hope that the government will consider setting up premium hospital beds in public hospitals on the basis of voluntary health insurance. The fourth point is about hospital or complications. In terms of doctors' fees and hospitals' fees and charges, I believe that we can enhance the transparency. Because of complicated cases, definitely more time will be needed for the surgeon to perform the surgery, not to mention a bigger team and equipment, anesthesia, etc. So when there are complications, another surgery may have to be performed. That will cause the price to go up. So there may be uncertainty in terms of fees and charges. I'd like to seek members' enlightenment. The first point is for the private hospital to roll out packaged fees. We take a fixed price approach regardless of whether there are complications. The second suggestion is that the patient buys a one-off insurance for possible complications, and that indemnity can be provided if there are complications. The third suggestion is to allow separate claims for complications that may come up according to the doctor's diagnosis before the surgery and the actual complications that happen after the surgery. The fourth suggestion is to set up a fund to co-pay the expenses for complications, followed by a cap. Now, after all, the hospitals are not insurers. I don't think they should be responsible for taking up all the risk. The last suggestion is that there should be transparency on fees and charges as well as health insurance claims. We generally adopt a pre-approval mechanism for health insurance. I think a standard platform should be set up comprising the medical sector and the insurance sector. Before the patient is admitted to hospital or allowed to receive operation in a day center, the expenses should be declared through the online system, and the information should be passed on the insurers for pre-approving the applications so as to enhance transparency, and that patients will have a clear idea about how much they have to pay. At the same time, insurers will have a better grasp of the budget as to whether the medical procedures are really necessary. The IMAs to be set up will lay down the clinical pathways for common diseases so as to provide an objective reference for patients, doctors, as well as the insurance industry. And I believe these suggestions will provide a win-win for all. I will listen carefully to members' views. Thank you.
現在嘅待議
I now propose the question to you that Dr. David Lam's motion be passed. Mr. Edward Leung. Thank you. I speak in support of Dr. Lam's original motion. I thank him for moving the motion. I ask members to support my amendment. I am a spokesperson of the Health Services Panel of the LegCo. I've been following issues relating to health services. The first topic I raised in this council was the excessively long waiting time in public hospitals. Patients having to wait till their ailments become serious illnesses. I thank Dr. Lam for moving the motion so we have another opportunity to discuss about this important topic. On the 25th of March this month, the administration announced the result of the fees and charges reform. There was a strong response from the community. Members of the public have been talking to us when we visit the districts. We understand that there is an aging population. Without any kind of reform, the waiting time will be longer. The pressure on the public system will increase. In the end, we may end up like the NHS in the UK when the service simply can't cope. We support the administration's effort to reform. We fully understand the difficulties involved. The public are also concerned whether the reform will make it more difficult for them to see a doctor. I move the amendment in the hope that in addition to reforming the fees and charges, the efficiency of resource allocation of the hospital authority should be enhanced. If it's better used, then the fees will not be increased in such a high extent. We also have to consider the pace of increase. It should not be too frequent, too fast, and too often. Since the announcement of the reform, we have received a lot of calls of inquiries. They are concerned that in the first stage, the extent of increase is already too much. The administration's goal is that within 5 years, the subsidy rate will be driven down to 90%. This, in turn, will increase the pressure on the general public. When there is a biannual review, that means there will be 2 adjustments within 5 years. Would it be too fast, too frequent, and too radical? We'll see. There is another concern. Fees for A&E will be increased from $180 to $400, an increase by 125%. People are concerned that with such a low charge, $180, there may be abuse. However, without support, even when the fees are increased to $400, patients will still pay that amount to seek help from the A&E, especially those who need attention overnight. I asked the administration to increase services, evening services, so that there will be another option in addition to the A&E. For the reform to succeed, we need to rely on not just the public sector, but the private sector as well. There has been a number of discussions, and there is a consensus that fees transparency and the number of package charging will affect patients' preference. To the middle class, they are concerned that if they fall ill, they may at the same time fall into poverty. That's why they will rather wait for services in the public sector instead of being financially damaged by going to the private sector. We need to give assurance to those with means that they will be able to receive proper services at an affordable rate in the private sector. This, in turn, will alleviate pressure on the public sector. All in all, we want to make sure that the fees reform will alleviate pressure on the public sector, at the same time encourages triage for patients to switch to the private sector. I submit. Mr. Ka-piu. Dr. David Lam is a medical practitioner. I appreciate his determination and energy in advocating for reform. Well, he has put forward a number of good ideas. Say, for example, complications. If you go to a private sector, you expect and want to pay just one fee instead of being startled by additional exorbitant charges. I thank Dr. Low, the Secretary, for taking forward a reform. On an healthcare occasion, I heard from the Secretary that he expected to work as a partner with the private sector. However, currently it is polarization. There is unbearable pressure on the public sector, but there are at the same time problems with the private sector. The insurance sector is having a tense relationship with the private sector as well. I'm a board member, not paid, of the medical board of the Chinese University Hospital. The way forward is that if we don't reform, it will be a path of doom for us. It's not the case that all patients have to go to the public sector. Patients can go to Shenzhen to seek medical help. Say, for cataract, kneecap replacement, these common but risky operations, patients go to the mainland to seek help. Don't forget that the R&D level and the quality of service are quite high. Patients from Hong Kong seek help to treat their cancer or serious illnesses on the mainland. If we do not see that reform to be our goal, if the private and the public sector don't have the mentality that they share the same fate, reform will not be successful. I have made 3 suggestions in my amendment. I understand that some members may vote against them. First is a sharing of health record between the private and the public sector. I'm sure this will be supported. We already have a bill. The second point is a mediation mechanism to handle disputes between patients and the private sector over exorbitant fees charged. I'm sure there is support for mediation, so this will be voted for as well. The third suggestion is to mandate the private sector to provide all services at package charging. I don't think private hospitals dare to object to it openly. I think the crux is all services. Dr. Low talks about visions. I think we need to give a vision to patients and insurance companies that they can have a practical budget, that they will not be slapped with an exorbitant bill. Members, if you are going to vote against it, please state clearly in your speech whether you do not agree with package charging or having all services at package charging it's too much. If that is the case, then what is the extent? Over 50% of the services of the CUHK hospital is at package charging. Do you think it's excessive? Well, and what are your suggestions in relation to getting the private sector to do the same? I don't have much time, but I still have a suggestion. Private hospitals are sitting on government land. They use the land at very cheap rent or even just a nominal $1 rent. Should there not be a term in the land lease requiring private hospitals to provide a certain percentage of services at package charging? I so submit. Dr. Hoey Lee. Thank you, President. I also thank Dr. David Lam for moving this motion. It gives us an opportunity to talk about this burning issue. My amendments are to do with studying in detail about promoting financing sources to ease the physical pressure on the public sector as well as to bring about long-term reforms. I say that it is a burning issue because there has been years of discussions on healthcare reform. We failed to reach a consensus. That's why, hence there is not much change. According to the latest figures, spending on healthcare is about $141 billion, which is about 17% of the total expenditure. Subsidy rate of public sector is 97.6%. With an aging population, healthcare expenditure will continue to climb. The main financing for healthcare is a subsidy by the government. This is not often seen in other jurisdictions. In addition, we have a simple low tax regime. We don't have sales tax. We have a narrow tax base and limited types of taxes. Government revenues is volatile, subject to changes in many factors. Healthcare expenditure inevitably will continue to rise. If we rely on this sole financing option, it is unsustainable. Back in 2019, that was the VHIS plan, and in March this year we have the fees reform. The goal of healthcare reform is to alleviate pressure on the public sector. Currently, utilization rate is still high. About half of the doctors are working in public hospitals, taking care of 90% of patients. There is a serious imbalance. VHIS, a voluntary health insurance scheme, we don't know how effective it is. In the paper submitted to the LegCo, in the first round of the fees reform, the overall subsidy rate on public sector still stands at 94%. We will change the copayment towards a copayment system to trigger a change and reduce resource wastage. The direction is right, but the subsidy rate is still high. The structure of financing is still not diversified. Regardless of means, patients pay the same level of fees. In this form, there is a low administrative cost, and it also achieves wealth reallocation. However, with an increasing expenditure on healthcare, this arrangement will increase our tax burden. The budget will balloon. The pressure on our future generation will increase. The over-reliance on public health care will aggravate. We need to conduct an in-depth study on different types of financing sources, not limiting to general taxation. It can also cover user pay, personal healthcare reserve, as well as insurance. We need to take into account other different factors as well. In any event, we need to come up with different reform options to put in place a sustainable structure. Healthcare financing is a problem faced by many different jurisdictions. Reform is one of the most difficult initiatives. I use the word in detail because since it's difficult, we need to have in-depth reform We need to explore sustainable options to alleviate pressure on the public sector. I so submit. I've drawn reference from the content of the original motion by Dr. Lam in coming up with my amendment. I ask members to support the original motion and my amendment.
Mr. Chan Pui-leung. Thank you, President. Hong Kong has an aging population, and with that there is higher demand for health care, and with the escalating cost of health care facilities, the healthcare spending has also been on the rise. We need a system that is sustainable. According to the government statistics, deducting expenses on COVID, in 2022-23, the total recurrent spending on healthcare in Hong Kong amounted to $226.3 billion. The government's recurrent spending accounts for 52% of the total, and 30% comes from insurance. According to the WHO recommendation, the co-payment percentage should be lower than 20%. Public health care is the major source of financing. The government takes up 97.6% of total spending, and this is unhealthy. There is an imbalance. It is not sustainable. There has to be a change. I need to declare that I work in an organization that provides medical insurance. I believe in order to have good medical financing in our city, we must leverage on market forces. Private healthcare insurance will provide quality health options for the insured. Risks can be shared. More importantly, the government-regulated voluntary health insurance scheme can help put pressure off the public healthcare system and in the long term cope with the huge medical expenses. I need to point out that for private insurance and insurance schemes provided by employers, the percentage in 1989-90 was just 4.9%. In 2022-23, this figure jumped to 17%, with totaling 38 billion Hong Kong dollars. At the same time, private insurance increased from 1.4% to 10.4% in the same period of time. As in the end of 2024, 1.34 million insurance policies were issued under the voluntary health insurance scheme. Over half of them, over half of the policyholders were below the age of 40. I believe that there is now greater public awareness on risk sharing and medical insurance. The government should provide more incentive, such as a higher amount of tax allowance for voluntary health insurance to attract more young people to take out healthcare insurance early, so that they don't need to pay a higher amount of premium as they get old or as they become ill. At the same time, I need to make another point. There is a lack of transparency on medical fees and charges. People are not sure how much insurance coverage will be provided when there is a need to pay for private health care. Some healthcare service providers may, depending on the insurance policy of the patient, charge more for some items covered by the insurance policy. That causes the insurance premiums to go up. We need to enhance the price transparency of private healthcare services. It is important to salvage public confidence. We can also address disputes, and this way we can encourage more patients to turn to private healthcare, especially those with medical insurance coverage. Not only that will that put pressure off the public healthcare, it can also prevent unnecessary escalation of medical costs. Legislation should be put in place to enhance price transparency so that the public are clear about the service items and the relevant charges. insurance companies will have objective data to set affordable premium levels. This can help curb medical inflation, and only by doing so will we have sufficient forces to promote healthy and sustainable development of the healthcare sector. I support the motion, and I urge members to support the amendment.
Secretary for Health. President, I thank Dr. David LAM for proposing this motion on comprehensively promoting healthcare financing reform and making optimal use of public and private healthcare resources. I thank Mr. Edward Leung, Mr. Bill Tang, Dr. Simon Lee, and Mr. Pui-leung for their amendments. We're given the opportunity to discuss in depth the sustainable development of Hong Kong's healthcare system. Hong Kong has been maintaining a simple and low tax regime. There is no mandatory health insurance system. It provides 97.6% of subsidy rate. It is a safety net for all. This ensures that members of the public will not be deprived of appropriate medical treatment due to lack of means. The private healthcare system, on the other hand, offers more personalized choices to those who can afford it. With an aging population, increased prevalence in chronic diseases, and advancement in medical technology, healthcare expenditure goes up, and this puts the ability of the local healthcare system to continuously operate in an efficient manner to the test. Medical reform covers medical devices, health insurance, as well as healthcare. We need a consistent objective. We need a policy-oriented measure. In the third plenum, the country proposes to deepen the three medical linkage as well as healthcare reform. In the past, we have had a number of discussions on healthcare financing reform. Back in the 1990s, the government engaged a consultant to conduct a comprehensive review of the healthcare system in Hong Kong. The Harvard report, it was popularly known, concluded that it would be difficult for Hong Kong to continue to use its public money to pay for the healthcare expenditure in the long run. Following the release of the report, the government issued in year 2001 a consultation document titled Lifelong Investment in Health, which proposes the way forward for our healthcare services structure, quality assurance, and financing system. The government was contemplating a review of the public healthcare charging system. It encouraged members of the public to take out private health insurance and explored the idea of introducing personal medical savings accounts. After that, from 2008 to 2010, the government launched a two-stage public consultation on healthcare reform to explore in depth 6 supplementary financing options. In 2008, in the first stage of the public consultation, Your Health, Your Life, 6 options were proposed. 1. Social health insurance. It requires citizens in employment to contribute a certain percentage of their income for healthcare use for the general population. 2. Out-of-pocket payments, that is to increase the fees for public healthcare services. 3. Medical savings accounts. It requires people in employment to make mandatory contributions based on their level of income, and the investment return will be used to pay for their healthcare expenses. 4. Voluntary private healthcare insurance. This entails medical benefits provided by employers and individually purchased medical insurance. 5. Mandatory private health insurance, an insurance mandated to be taken out by law on a population-wide basis. And 6. Personal healthcare reserve, that is, a scheme which combines the features of medical savings accounts and regulated private health insurance. These 6 options have their merits and drawbacks. There were divergent views in the community back then. The community was in favor of the idea of voluntary health insurance and had reservations about the mandatory proposal. People leaned towards the option of pooling the risk rather than creating personal savings. There was a greater acceptability of the voluntary private health insurance plan. Therefore, in 2010, the government conducted the second stage public consultation under the theme My Health, My Choice, which focuses on the voluntary health insurance proposal. After discussions with the healthcare sector, the insurance industry, patients' organizations, as well as relevant stakeholders, the government introduced the voluntary health insurance scheme in 2019. It aims to provide the general public with a choice of individual indemnity hospital insurance products, which are subject to specific regulation and of high market transparency. It is to give consumers confidence in purchasing health insurance so that they can use private healthcare services when in need. In retrospect, it isn't hard to notice that the development of our healthcare system is in line with the expected trajectory years ago. And there is a pressing need for us to have a reform. Therefore, we need to speed up the reform. According to the data in the past decade, our total health expenditure in 2012 to 13 accounted for 6.1% of our GDP, and the percentage rose to 8.4% in 2022-23. And the share of public healthcare expenditure in the GDP also increased from 3% to 4.6%. With rapid population aging, the above growth trend is expected to continue. The latest data show that the number of elderly people, that is those aged 65 and above in Hong Kong, will increase from 1.72 million, that's 24% of the total population in 2024, to 2.74 million, that's 36% of our total population in 2046. According to the operational experience of the Hospital Authority, the utilization rate of medical services among elderly citizens is significantly higher than the younger population. Elderly people currently account for about 24% of the total population in Hong Kong. In spite of that, they account for half or over 2/3 of all patient days and A&E admissions, and over 1/3 of general outpatient clinic and specialist clinic attendances. Therefore, the future healthcare expenditure will only increase, and the current financing model will not be sustainable. Through our analysis, we see two structural phenomena. First, primary healthcare services. Compared to the secondary and tertiary level, the recurrent health expenditure reached $226.3 billion, of which about $62.3 billion was on primary health care and $164 billion on secondary and tertiary health care. The ratio is roughly 3:7. This shows that we rely more on treatment than prevention. We need a better plan to make use of our family doctors in the prevention, treatment, and management of chronic diseases so that we can reduce our reliance on tertiary as well as secondary healthcare services. Now, on the secondary and tertiary healthcare in the public and private sector, according to the domestic health accounts for 2022-23, the public healthcare system accounts for about 2/3 of the recurrent expenditure on inpatient and ambulatory care services, but it has to deal with nearly 90% of the inpatient and ambulatory cases in Hong Kong, whereas the private healthcare system accounts for 1/3 of the expenditure, but it only handles about 10% of the inpatient and ambulatory cases. This reflects that there is an imbalance between the public and private healthcare services. It is estimated that about 76% of the expenditure on health insurance will be spent on secondary and tertiary health care as well. How can we make better use of health insurance so that those who can afford it can pay for the expenses? And this is to ensure the stability of our healthcare system in the long run. As President Xi Jinping said, health is the most important indicator of people's happiness. The current term SAR government is committed to deepening the reform of our healthcare system to ensure the sustainable provision of quality services to the public. Through promoting the reform in healthcare, medicine, and health insurance, we hope to enhance the quality, efficiency, and sustainability of our healthcare system in a holistic manner. The reference to the three medical linkage in Hong Kong corresponds to our reform efforts in the three areas, namely healthcare services, healthcare products, and healthcare financing. On healthcare services, the Health Bureau promulgated the Primary Healthcare Blueprint to proactively promote the development of primary health care, strengthen preventive services, tackle minor diseases at the community level, optimize public health care services, and take forward the deepening of the reform of the HA to enhance healthcare quality. On medical products, we have expedited the introduction of innovative medicines and devices to facilitate good drugs for use in Hong Kong through the 1+ mechanism. We are actively establishing the Preparatory Office for Hong Kong Centre for Medical Products Regulation to restructure and strengthen the approval regimes for drugs and medical devices so that the public can benefit from the latest achievements in our scientific research as early as possible. Regarding today's motion, I believe that this is not restricted to the discussion on insurance. It is also about ensuring the financial sustainability of our healthcare services. In the area of public healthcare, the government announced in March this year the public healthcare fees and charges reform. It is based on 5 major principles: no reduction in commitment, co-payment by those who can afford and those with mild conditions, enhancement and reduction, high subsidization, and gradual and orderly manner. This helps ensure that we can achieve 3 major objectives, namely 1. Reforming the subsidization structure and steering the use of the services, 2. Reducing wastage and misuse and enhance the efficiency of services, 3. Strengthening healthcare protection for the poor, acute, serious, and critically ill patients to strengthen the safety net for all and enhance the sustainability of the public healthcare system to address the imbalance. In the private healthcare sector, we have just briefed the panel on health services in May on the legislative proposals to enhance the transparency of fees and charges of private healthcare services. This includes requiring private healthcare organizations to publish price information in a specified format, requiring private hospitals to provide cost estimates for their services, and requiring private hospitals to report and disclose previous data. We will propose long-term enhancement measures. This will allow the public to have information for comparison before they receive medical services. Starting from this month, the Health Bureau will meet with stakeholders to conduct in-depth consultation on the proposal. As for health insurance, the latest data show that private expenditure accounts for about 48% of the total recurrent expenditure on local health care, with out-of-pocket household expenditure accounting for 63.1%, privately purchased insurance plans 21.4%, and employer-provided insurance plans 13.2%. The role of insurers as a third-party payer is becoming increasingly important. Since the launch of the Voluntary Health Protection Scheme in April 2019, well, we've had a growing number of insurance policies. As at April this year, we have had 1.428 million insurance policies. It is estimated that it will account for about 1/3 of the total personal indemnity insurance market in Hong Kong. The government will continue to promote the voluntary scheme and collaborate with the insurance industry to make it a mainstream product, so to provide greater protection for patients. President, deepening the reform of the healthcare system, in particular the issue of healthcare financing, requires the understanding and support of the whole community. The government will keep an open mind and listen to the views of various sectors. I look forward to members' speeches, and I will respond to them in my concluding remarks. Thank you.
Dr. Martin, President, healthcare underpins people's livelihood. It is also the top priority of government policies. Healthcare spending is a significant portion of total government spending. In 2024-25, the total estimates on healthcare reached $109.5 billion, or 19% of recurrent spending. Hong Kong has an aging population. We must ensure that the healthcare system continues to deliver quality services and that it is sustainable. We provide equal treatment to everyone, including visitors, illegal immigrants, or overstayers. The subsidization level is over 90%. I think in principle we should accord priority to Hong Kong residents. Now, for eligible persons or persons who are eligible for public health care, they include Hong Kong ID card holders, children below the age of 11, and other persons recognized by the hospital authority or director of health. They can include illegal immigrants, overstayers, and visitors. For ineligible persons, if they are not able to prove their eligibility, they will be required to pay the deposit when being admitted in public hospital. But afterwards, they may just leave Hong Kong without paying the fees and charges. And this approach has attracted ineligible persons coming to Hong Kong, especially for medical treatment. I think that we should demand these people to take out medical insurance before coming to Hong Kong. This can help promote tourism. This can also ease the burden on our public health care system. It also helps generate revenue for the government. The government should also review the eligibility of patients. Should we include those who have emigrated elsewhere? Shouldn't we set up restrictions? Now, under the principle of optimal use of public resources, we should focus on caring for Hong Kong citizens who are in their senior years. For Hong Kong residents between the age of 21 and 60, especially those who are in the workforce, they are people of means. The government should provide policy incentive to encourage them to take out medical insurance and to increase the co-payment percentage. In the past, this percentage was low. It was only 2.4%. There was a mismatch on resource allocation. The government announced public health care fees and charges reform in March this year, exactly because of the mismatch in resources. Through this reform and through enhancing transparency, we seek to rationalize public healthcare resources and reduce wastage. This can help make the system more sustainable. I support the reform. There should also be higher transparency on fees and charges. The hospital authority itself can consider setting packaged charging at a level lower than that in the private sector. And that more experienced doctors can charge more under the public healthcare system so as to generate additional income and offer more choices for the general public. This can help prevent the brain drain in the public healthcare sector. It can also provide reliable backing for reference by the insurance sector. Now, President, Hong Kong's population is aging fast. Aging in place should be the top priority and the way of life for our people. I so submit Ms. Rebecca Chan. Thank you, President. According to the CNSD, in 2014, 15.4% of the population were aged 65 or more. In 2024, the percentage jumped to 23.9%. Senior citizens have high demand for health care, and naturally, with an aging population, healthcare spending will continue to go up. We mentioned a number of times in the past that the funding for HA increased from $49.7 billion in the beginning of the decade to $97.3 billion last year. That's up by 200%. With medical inflation, and the aging population will inevitably jack up medical spending. One way out is medical financing. This is the crux of the discussion. There are various healthcare financing approaches. For example, in the UK, they have the NHS. In Singapore, they also have a or a mixed mode of healthcare financing combining savings and government subsidy. In European countries, many governments also provide a mixed mode of welfare and co-payment model. In 2008, the Hong Kong SAR government published a consultation paper. It puts forward 6 financing options, including a central insurance system as well as the voluntary insurance scheme, which was implemented in 2019. What I want to point out is that raising medical fees is just one way of healthcare financing. More importantly, we need to optimize the use of resources. In 2008, the government earmarked $50 billion to promote healthcare reform. $10 billion ultimately formed part of the public-private partnership fund to support the HA in procuring services. In 2023-24, with expansion of the PPP program, service capacity reached 130,000 attendances. No additional resources are required. However, this scheme may lapse soon. The fund will be plowed back to the public coffers. According to the government's explanation, the co-care model will be adopted for the HA to procure services in a strategic manner. Strategic procurement can help reduce service overlap and duplication in service procurement. This can help save costs, but when it comes to procurement, we still need to fork out money. Well, in the current fiscal position, I think we should expand the PPP. For example, the $50 billion committed to healthcare reform should be used to support strategic procurement. In 2019, the last term of government earmarked $10 billion for a stabilization fund for public health care. Now, I've never heard anything about this fund being used, so perhaps the fund should be used in combination with the $50 billion already earmarked for healthcare reform to take forward healthcare financing. That's the second phase of voluntary health insurance scheme. Well, when the idea was first floated, the government already proposed setting up a high-risk pool with 10 billion out of the $50 billion in for healthcare reform. So it's been 5 years since implementation of the VHIS. The government should put in place enhancement measures, including the feasibility of a high-risk pool and expansion of the coverage of the insurance scheme. A diversified financing approach should be considered. For example, monthly contribution from the public together with a matching model, so as to make sure that the system is sustainable. Tax deductions should be allowed. This way, we can encourage people to save up for medical expenses. In the long run, the government should have better planning on the use of resources. The government should listen carefully to the views of the public so as to put in place appropriate measures to support the sustainable development of the healthcare system.
Mr. Lewis Long. President, today we are discussing the topic of healthcare financing reform, that is to increase the coverage of health insurance and increase the price transparency of private healthcare institutions. Well, these are not enough, I think. We have to have healthcare financing reform so that we can help those in need. In year 2025-26 estimate, health is the top priority. It reaches $140 billion, accounting for 17.2% of the total government expenditure. Public healthcare expenses come from tax, and increasing tax levied does not mean that we can cover the expenses. For those who pay profits tax, well, 60% of them are from the middle class. President, do you think they want to use public healthcare system? The HA took 70% of the fund, but the charges are way lower than the cost. It's hard for people to get consultation service. The waiting time is long. For those who have received MRI service as well as they have to wait for about 64 weeks. For those in the middle class, if they do not want to wait for very long, they have to go to private doctors. The fees are expensive. For those who have taken out insurance, well, it's not going to help either. So I agree that we have to optimize the use of resources. We have to make good use of our public money to take care of everyone from all walks of life. So how can we do that? My suggestion is, under the current elderly healthcare voucher scheme, we should have enhancement so that every citizen in Hong Kong have a medical saving account. Each account holder, every year, they should be given an amount as a subsidy, and the account balance can be accumulated. And the account could be shared with family members, and this can help deal with any unexpected healthcare spending. You may wonder if that would cost a lot more public money. My answer is no. This is because I'm not asking for additional allocation from the government. I'm asking the government to redistribute the existing resources we have. Currently, the HA fees are much lower than the cost, and so demand is much higher than supply, and the middle class has to turn to expensive private healthcare services. So we have to tackle this problem through economic or financial means, through redistribution of resources, where we can establish a medical account for each person. We should also adjust public healthcare services charges to narrow the gap between public and healthcare services. Then people can make use of the money they have in their account to opt for the services that best suits their needs. Then this can address the imbalance between public and private healthcare services. We can also have universal health coverage that way. Well, this is a wisdom from the Confucius. The tax policy in Hong Kong is based on the principle of affordable users pay. Even with healthcare financing reform, we may not be able to address the imbalance. For the middle class, they're not just paying for what they can afford, they are also paying additional for what they should deserve. I think we need a comprehensive reform for healthcare financing. Thank you. Dr. Teck Chi-yun. President, I thank Dr. David LAM for proposing such an important motion. The healthcare system in Hong Kong is facing a structural challenge and crisis. This cannot be dealt with just by increasing the fees. We have to do it from 3 levels. First, we need healthcare financing. We need primary healthcare as well as public-private partnership. First, on healthcare financing, we have to ensure sustainability. In year 2023-24, healthcare spending accounts for 9.1% of our GDP. It accounts for 90% of our public money accounts for 90%. Just by increasing the fees is not practical, and members of the public from the grassroots cannot afford high expenses. The current voluntary health insurance scheme does not tackle the root problem. It lacks the risk pool, and it excludes those with chronic illnesses. This is just a commercial product. So we need a comprehensive financing reform and system. We need a tripartite mandatory financing system with the government, employer, and employees taking up the expenses together. We need a dedicated fund to ensure sustainable sources of funds. We need a risk pool, and we need to mandate insurers to accept all kinds of applicants to ensure co-payment. Now, on primary health care, we need to switch from treatment to prevention. Prevention is the most effective means. Early intervention can help us control long-term healthcare spending. We have to fill the gap on healthcare services. Currently, we cannot get public consultation service at 9 p.m. We can only go to the ANE, but we may be criticized for abusing resources. We have to address this. So I think there should be a secondary healthcare system to deal with those with chronic illnesses. To keep the patients at the district level, we have to expand services of district healthcare centers. There should be standardized health checks, and the government should work with employers to roll out leaves for health checks. There should also be community pharmacies so that pharmacists can offer dispensary service. In the long run, there should be a segregation between pharmacies and hospital services. Thirdly, there needs to be public-private partnership. Currently, there is a gap between public and healthcare service. Private service lacks price transparency. Private healthcare institutions have not been able to help take up patients from the public system. We need to adopt a multi-pronged approach. We need to enhance price transparency of private healthcare services. The services should be charged at package charging. There should be more responsibility taken up by the private healthcare institutions that receive preferential treatment from the government. There should be health record sharing to reduce duplication of services. There should be fee waiver mechanism. The LWB should establish a database for those in need for the waiver system. On the fees and charges, there should be a fee exemption mechanism. The relevant procedures should be streamlined so that those from the grassroots can afford their healthcare expenses. Also, we should expand the safety net for medication, especially those with rare diseases, as well as for those who suffer from serious illnesses. We've been talking about financing reform for 30 years. There's no room for us to delay this reform. We need to have a comprehensive and systemic reform instead of little patches. This is to ensure a sustainable healthcare system as well as the well-being of our citizens. I so submit. Thank you. Reverend Peter Kuhn. Affordable public healthcare services is a type of benefit of our citizens. And that's why members of the public always go to public hospitals for help with an aging population as well as a higher prevalence of chronic diseases. We will see higher demand for public healthcare services. Currently, we stress treatment over prevention. If we carry on with this model, well, the healthcare expenses will continue to account for 90% of our total expenditure. This is not affordable. We have to prepare early so that we can cope with the huge demand for healthcare services. We stick to the current financing model, even with greater allocation from the government as well as higher service efficiency in the public system, it will not be able to ensure sustainability still. We can only increase tax or reduce other types of services in order to carry on with the provision of the public services. This is not sustainable, so we need a financing model. As to what kinds of model we should adopt, I think the government can learn from other advanced economies, especially those who use public healthcare as the backbone, for example, Australia and Canada. Each country, based on their historical background and their circumstances, they integrate different kinds of financing models. For example, social health insurance, savings accounts, voluntary health insurance, as well as out-of-pocket payment. There's no one place that adopts a single model for financing. I think we need to adopt the users pay principle, and that meets our needs. And there are two merits to this model. Patients have to take up the additional expenses. For those who misuse and abuse the services, well, they can be taught to use our public services in a more responsible manner. And also, this will increase the amount of payment for our citizens. This can ensure that each person is responsible for their own health. However, the government will have to strengthen the safety net at the same time to take care of those who cannot afford the increase of healthcare spending, including elderly people, the disabled, and those with chronic illnesses, as well as the low-income people. This may involve a huge amount of income asset test. We should have a fee waiver system, and this can help reduce our financial burden. Well, all in all, we see an increasing healthcare expenditure, and this shows that there are problems with our existing system. However, most people lack the knowledge about healthcare financing reform. The government should explain that there is a pressing need for us to have a healthcare financing reform. I hope that the government will launch a new round of public consultation soon so that we can reach a consensus on this topic and that everyone can work hard for this. Thank you.
Mr. Robert Lee, thank you. We have an aging population. The population with chronic illnesses is increasing. It adds to the healthcare expenditure. The recurrent expenditure for 2025 and 26 is about $131 billion, about 19.6% of total expenditure, an increase by about 30% compared to not long ago. If we are to maintain service quality, I agree that fees should be increased as stated in the Fees and Charges reform. In recent years, the administration has launched various measures, including the VHIS, public-private partnership to encourage patients to switch to the private sector. This alleviates the pressure on the public sector. However, there is still a lot of room for improvement in terms of price transparency in the private sector. If we are to make the public more confident in using the private sector, then we need to do more. I have some suggestions. First, to enhance fees transparency, and two, to increase service quality. According to a Consumer Council report, in general, the price list of private hospitals don't set out doctors' fees. It needs to be set. Doctors' fees may change according to the ward, the level of ward selected. The higher the ward, the higher the doctor's fees. Other fees such as treatment and procedures will be more pricey as well. That is not fair. That's why I agree with what Mr. Pui-leung said in his amendment. We have to address the problem of medical inflation because of low price transparency. Services and different items should have their prices set out. The government also needs to make use of the latest technology to improve treatment efficiency, to streamline procedures in order to drive down cost. They can make use of AI to enhance checks and management efficiency. There is a huge growth in the healthcare sector. 2025 to 2034, the global capitalization will increase by about 100% to about $700 billion US. The compound yearly increase reaches 8%. We have in Hong Kong over 300 biotech companies. We have listed companies relating to healthcare products standing at over 200. We can make use of various measures to attract more companies to come to Hong Kong, encourage them to work with Hong Kong hospitals to enhance the level of service. For those with means, they should be encouraged to switch to the private sector. However, there is low price transparency in the private sector. All these are obstacles stopping the public from using the private sector. We need to enhance the efficiency and service quality of our healthcare service. We need to put in place various measures to meet future needs. I speak in support of the motion and the amendments. Mr. Chow Man Kong. I speak in support of the original motion and the amendments. It mentioned in the motion that there was the announcement of the fees reform in March. Unless it's an emergency case, if you go to use public services, the fees will increase. If you go to the A&E, you have to pay $400. Not many people want to wait for hours there, but I don't think it is the right way to have such a hefty increase. There can be other means to implement the reform. Say, for example, make use of healthcare vouchers, increase evening services, and this will improve acceptability of the reform. I have some suggestions in relation to the direction of the reform. We have an aging population. The problem will only aggravate. Adjusting public healthcare fees is only an expedient measure. We need to encourage the middle class and those with means to prepare as soon as possible. They can be encouraged to go to the private sector to release the beds and service capacity for those in need. This will address the problem of an imbalance. It is very difficult to complete all the procedures in the private sector because of the hefty fees. Using cancer as an example, for checks, treatment, and post-treatment care, you have to pay through your nose. Even if you are in the middle class, you may go bankrupt. There is a practice nowadays. I don't encourage it. People go to the mainland to try to seek medical help. In relation to healthcare insurance, I think the approach is rather conservative. Taxpayers may take out insurance policies for themselves and their children, but the amount of allowance is very small. $8,000 is the maximum premium allowed. When it comes to making preparation for your own retirement, you can only use one of the measures, that is the annuity, to have the tax deducted. Can the scope be expanded? In terms of financing reform, we need to make one thing clear: which is the best way? I've also mentioned that there is manpower shortage. There is a competition for manpower from public and private sectors. It is inevitable that we need to allow non-locally trained healthcare practitioners to come to Hong Kong. There will be a third teaching medical hospital. Even if the works start tomorrow, it will take at least 10 years before it is commissioned. We've all worked very hard to enable non-locally trained dentists to come to Hong Kong to work. They receive about 90 applications or so. In the end, only 12 are allowed to practice in Hong Kong, and so far only 3 have started. I asked the Secretary to look into it to see if there is any area that can be improved to improve efficiency. Stakeholders should do their best to remove barriers. They should enable non-locally trained doctors to practice in Hong Kong. Otherwise, we will not be able to address these deep-rooted issues. We now have a lot of pharmaceutical products. The first question you ask when you go to see a doctor in the private sector is whether you have taken out insurance. If so, then they will try to max your coverage. We need to do something to maintain the sustainability of our healthcare sector. Mr. Chen Kim-po. I thank Dr. Lam for moving the motion, and I thank members for their amendments. We have had a number of discussions in this regard. In 2019, the VHIS was launched. It was an important breakthrough. As of March last year, we have over 1.34 million policies taken out. In terms of financing, there are 3 pillars according to figures in 2022 and 2023. Public expenditure accounts for about 58%. When it comes to commercial insurance, it accounts for about 15%. In March this year, the government announced the fees reform. In May, there was also the announcement that there will be legislation to ensure price transparency in the private sector. All these measures signify the important milestones in terms of healthcare reform. We need to review the financing structure. We need to make good use of resources to improve efficiency. The subsidy rate with the reform will be driven down from about 97% to 90%. This helps to enable sustainability. In the public sector, there will be fees increase. At the same time, there will be exemptions as well as waivers. There is a group of people that will benefit from these measures. There is also a cap of $10,000 spending on public health care. In addition, there are also additional safety nets. The beneficiary number will increase to about 1.4 million people. The safety net is stronger as a result. On a number of occasions, I've commented that healthcare inflation is huge. As a result, insurance companies will have to pay out significant sums. Some families in the middle class are unable to afford to treatments and procedures. For the same procedure, the price difference is significant between private and public sectors. Patients are concerned that they are unable to afford to pay. Sometimes they have to give up on using their private insurance and have to go to wait in the public sector. There is a lack of fees transparency in the private sector. In view of this, the government established the Institute for Medical Advancement and Clinical Excellence. A common clinical protocol will be put in place for the private sector to use. There may be improper practices, trying to charge more. At the same time, these improper practices will harm patients. It is suggested that if the final bill exceeds the budget by about 20%, that should be a written explanation. In the future, there will also be a platform setting out the difference in prices between the private and the public sector. The most important thing is that the private sector must understand that the reform will take place. The landscape is changing. For Grade A hospitals in Shenzhen, for dental services, the fees is just a fraction of that in Hong Kong. The quality of service is good. Some say that they have treated about 100,000 patients from Hong Kong, which is about 50% of their patients. If the private sector continues to charge an uncertain yet high price, a lot more patients will go to the mainland. The healthcare sector in Hong Kong needs to wake up. They need to keep up their high professionalism by providing good quality so that they will be able to maintain their competitiveness.
Professor Chen Wing-Kong. Thank you, Deputy President. I speak in support of Dr. David Lam's motion debate. I thank him for giving us this opportunity to exchange ideas on public healthcare reform. Public healthcare is the foundation of the healthcare system in Hong Kong. It provides a safety net. It also complements the private healthcare services. However, public healthcare is now highly subsidized. Every year, the government sets aside over $100 billion to cope with public healthcare spending. In the coming 10 years, the aging of our population will only get worse. It will reach its peak, and this will pose a major challenge to our public healthcare system. And inevitably, we must discuss the sustainability and quality assurance of healthcare services in Hong Kong. The government has been proactive in taking forward the public healthcare reform to protect public health and well-being. In March this year, the Health Bureau announced a public health care fees and charges reform. After putting in place the reform, the fees and charges for various health services, including the GOPC and A&E department, will go up quite substantially. According to the government, there is the medical fee waiver mechanism to protect grassroots. A recent survey, however, shows that half of the respondents have no knowledge about the medical fee waiver mechanism. The new level of fees may cause some of the middle class, especially the chronically ill, to face heavier financial pressure since they will be left out of the safety net. Now, I hope the government will ensure that the underprivileged and the grassroots will continue to be covered by the public health care safety net, and that appropriate treatment can be provided for those lack of means. This should be the unwavering principle for medical reform. Now, I want to emphasize the role of Chinese medicine in Hong Kong. 95% of Chinese medical practitioners have private practice. It forms a major force in the healthcare system. During COVID pandemic, we have learned the important role of Chinese medical practitioners. They help safeguard public health, and I hope that the government will further incorporate Chinese medicine in the healthcare reform to better leverage on their capacity. Chinese medicine provides a cheap alternative to Western medicine. For example, acupuncture treatment can be provided to stroke patients, including post-stroke care. Clinical evidence have shown the efficacy of acupuncture. It can also help prevent recurrence of stroke. Acupuncture also helps improve joint conditions. Now take joint kneecap replacement, for example. The waiting list in public hospitals is so long, but at the same time, private hospitals charge very dearly for such an operation. If we could provide acupuncture therapy to needy patients, we can slow down the deteriorating condition and the degeneration of knee joints, so that we can stabilize the condition. By allowing acupuncture treatment to intervene, we can shorten the waiting time at the public queue. We can also lower costs. This is the role undertaken by the Chinese medical practitioners. We can incorporate them in the primary care development so as to alleviate the burden on the secondary and tertiary healthcare. Well, this shows that Chinese medical practitioners can play a proactive role in public health. The Chinese Medicine Hospital of Hong Kong will be commissioned in the end of this year. I hope that a consensus can be reached with the insurance sector as quickly as possible so as to expand the VHIS coverage to Chinese medical services provided by the Chinese Medicine Hospital. I so submit. Mr. Holden Chow. I thank Dr. David Lam for moving today's motion so that we are given this opportunity to discuss optimal use of public and private healthcare resources. Judging from various figures, we see the need to take forward this reform. In 2024-25, medical spending reached $109.2 billion. That's 90% or 19% of the total spending. Against the backdrop of an aging population, in 2024, 1.72 million people in Hong Kong were aged 65 or above, but by 2046, this figure will go up to 2.74 million. With continuous aging of our population, there will be a lot of pressure on our healthcare system and the total healthcare spending. It is imminent that we promote healthcare financing reform and make optimal use of public and private healthcare resources. Years ago, the government rolled out voluntary health insurance scheme. And I'm happy to learn that as of today, at least as of 2024, 1.32 million insurance policies have been issued under the VHIS. That's 1/3 of the total in the insurance sector. It shows that the public welcome the VHIS as an option to receiving healthcare in the future. So the response is positive. Now, about optimal use of public and private healthcare resources, as mentioned by other members, there is a need to enhance the transparency of fees and charges of private healthcare. Only by doing so can we have greater assurance for the public to use voluntary health insurance or private healthcare, because they will feel confident about filing insurance claims after utilizing private healthcare services. Now, we've also heard some suggestions today. For example, in the future, a private doctor may first need to explain the relevant fees and charges to their client before the surgery or before a certain item. And that if it goes beyond budget, a further explanation is required. This is one way of enhancing transparency. Now, I have also talked to the sector. According to my understanding, for multinational insurance corporations, they have begun to adopt a new practice. For example, policyholders will be encouraged to patronize healthcare institutions or doctors on the list provided by the insurers, so that ultimately a better coverage can be provided, then there will be a higher chance of a successful insurance claim. I think the important point is to let the public know, in the end of the day, how much can they get from the insurance claim. This is one way of encouraging them to turn to private healthcare. I think more should be done to encourage greater transparency in the private healthcare sector, so that for consumers, they can make informed choices about the medical services they use, and that they can make comparisons. Now, lastly, I'd like to say that the government has rolled out a number of initiatives on primary care, and a preventive-based approach is taken. Say, for example, there are district health centers in all 18 districts. Prevention is better than cure. So I fully support the direction. At the same time, more incentives should be provided to healthcare institutions to better serve the public. During the pandemic, we had this experience. There were hiccups in engaging the private healthcare service providers to deliver services to the public. So I think a greater incentive should be provided. Professor Priscilla Leung. Deputy President, I speak in support of the original motion. I've all along been concerned about the aging population and manpower and resources underpinning the public healthcare system, and I have asked for the development of the second 10-year hospital development plan, and the BPA last month published a study report on a number of development directions relating to the healthcare sector, including biotech, pharmaceutical products, health equipment, Chinese medicine, medical tourism, medical education, cosmetic medicine, etc. Industrial developments can be undertaken in these directions so as to inject impetus in our economy. Well, in terms of healthcare services and especially public healthcare system, I'd say that we are all users, and I for one can say that we are top of the world. As far as medical tourism is concerned, recently we've seen a surge in the number of Hong Kong people receiving medical treatment across the boundary, including an eye test, dental services, so on and so forth, because of the cheaper fees. I feel quite positive about the so-called northbound medical tourism. We have an aging population in Hong Kong. As the Secretary just now explained, 30%, in fact 36% of people in Hong Kong are aged 65 or above. Now, for the inbound tourists, we should charge higher. Whereas for retirees in Hong Kong, if they find the services in the mainland acceptable, they should be encouraged to turn to the mainland institutions. Now, I know retirees who are in their 60s, they are the middle class, they don't want to live in the Greater Bay Area. They don't want to settle there, but they want to receive health care there. Now, I've heard the saying that for those who are 25 years of age, they queue up for public housing when they have yet to raise a family. For the middle class, especially for the 60-year-old retirees, they will queue up for public health care because they cannot afford health insurance. Now, I became a council member in 2008, and I received complaints about medical insurance. Corporate insurance is provided, or group insurance is provided for those working for major institutions. But once you retire, you are not covered by any medical insurance. So the only alternative is to line up for public health care right after retirement, because even for a minor surgery, it's very costly. It could be more than $300,000. And when you get old, you're not able to take out any medical insurance. The government should intervene. For those who are retiring soon, they may wish to convert their group insurance policy to personal insurance policy, and the government should step in and provide some assistance or advice. They should talk to the insurance sector. Even for chair, professor, and senior civil servants, once they retire, they need to pay huge insurance premiums. So we should enhance the transparency of insurance premiums as well. It should be handled in a systematic manner in order to achieve a breakthrough. So my point is about transparency of insurance claims and certainty. Finally, I'm fully on board of the idea of incorporating Chinese medical services in voluntary insurance. I'm a staunch supporter of Chinese medicine. So I look forward to a breakthrough. Many seniors in Hong Kong prefer Chinese medicine as long as they have insurance coverage.
Ms. Nexi Lam, I speak in support of Dr. David Lam's motion on comprehensively promoting healthcare financing reform and making optimal use of public and private healthcare resources. Currently, about $12 billion are spent on healthcare, and the public health care wards are always full. Patients have to wait for a long time, and they may miss the golden chance to get treatment. When their situation worsens, it will give more burden to our system. And we have a low birth rate, and again, this aggravates the burden. Back in 2019, those aged 65 or above, they only account for 18% of our total population, but they account for half of the A&E services, and the usage of our patient beds are 14 times of that for the younger population. And for those aged above 80, they need on average 20-some patient beds. With this situation, we cannot rely on the healthcare system anymore. We have to reform our system. We have to learn from the successful examples of the neighboring places to review our healthcare system. Last week, during the weekend, I took part in a GBA health seminar, and experts advocated a kind of reform that is, through the level of illnesses, we can set our fees, and for minor illnesses, they can be dealt with district health centers. For serious illnesses, they can be dealt with at large-scale hospitals. This is what we've been doing in Hong Kong. We can, through policy, encourage people to go to the healthcare institutions at the district level first. This can help promote primary healthcare, and people can also make use of their family doctors to lower the healthcare expenses for chronic illnesses. This also reduces the burden on the healthcare system. We should also seek smart medical development. In Shenzhen, there are systems through which people can make appointment for teleconsultation, and through the system some simple health checks could be done, and appointments as well as consultation and even health checks. There is a one-stop shop on the online platform in Shenzhen. Back in Hong Kong, we have our health record system. About 6 million people have registered to use the system, but there isn't a smooth sharing of health records between doctors or hospitals because there is no real-time sharing of data. This platform has great potential, but it is not made the best use of. And there is a huge gap in terms of the sharing of data. With big data, well, we should apply it to the healthcare industry. We should make use of smart tools to build a real-time healthcare database so that we can have a comprehensive grasp of the health data in Hong Kong. Through AI analytics, we can analyze the trend of our illnesses or diseases, then that we can better assess what we need to do to address the gap. I learned from Mr. Liang Wannian from Tsinghua University that we should have a human-centric approach. We should place more importance to our health in order to build a management system. In order to achieve this goal, we have to reduce our reliance on the A&E system. We have to make use of private sector to divert patients. And in order to do so, we have to have smart medical development. We need to make use of big data as well as AI to boost service efficiency. We also need a comprehensive healthcare financing reform to ensure that our healthcare system can develop in a sustainable and highly efficient manner. I so submit. Thank you. Mr. Tang Fei. Deputy President, I speak in support of Dr. David Lam's motion. Around the world, we do not see healthcare reform, but healthcare financing reform. It is about who should take up the healthcare expenses. Well, private healthcare services in Hong Kong are expensive. I'm not going to repeat the facts here. I'd like to talk about instead what kind of reform we need. First, on the model. Public services are nearly free, and private healthcare services are expensive. Should we have a new system to address the problem? Like Mr. Edward Leung said, there is the NHS system in the UK, which is near saturation. And the Hong Kong system comes from the NHS system. Dr. David Lam said there is the financing model in Singapore, and there is different levels of fees and charges. I cannot say on behalf of Dr. David Lam that this is a brand new model, but this shows a problem. That is, this model, similar to that of NHS, requires adjustment of fees, for example, those for general outpatient clinics as well as for A&E services. Or should we instead have a brand new model like that in Germany? It's called GKV. Well, we should think about this. Innovative technology can give rise to problems about fairness. We need to take this into account. AI healthcare brings shock waves. It can bring to us precision medicine and treatment, but of course it does not mean AI treatment. Some experts believe that within a short period of time we'll be able to cure cancer completely, but it doesn't mean that healthcare fees could be reduced with rapid development of technology. It's like smartphones. The advancement of smartphones lower the cost of it, but it's different for healthcare. Technology actually aggravates the gap between the poor and the wealth. We have different types of cancer treatment, and wealthy patients, they can make use of the better treatment, but for poor patients, they cannot make use of it. Some can make use of health insurance, but it doesn't really help. Like Professor Priscilla Leung said, it can only offer a one-time relief. So we have to look at the roles of the public and private sector. We should look at the ethical problem behind. For the wealthier people, they can afford AI or precision treatment. However, for the government, it should think about this. Be it free NHS services or self-paid health insurance, or the model in Germany, or public-private partnership model. How can we ensure the sustainability? We need to have as many people as possible to enjoy the benefits brought by AI treatment. This is because technology is widening the gap between the rich and the poor. So the government has to be forward-looking enough to take this into account when mulling over the financing reform. Now, we've had an administration-led model. How can we, in an efficient manner, consult industry sector, financial sector, as well as patient organizations, so that we can establish a financially sustainable model? How to consult them and reach a consensus and a decision, this is the key. Thank you. Mr. Lai Tong Kwok. Deputy President, I speak in support of Dr. David Lam's motion. In the 2024 policy address, the CE said the government would legislate for the price transparency of private healthcare services. I hope this debate will allow us to have a better understanding about this and that we can promote the relevant policy. I will talk about how to increase price transparency at the private sector. Currently, we are adopting a dual-track approach. According to data, 52% of the healthcare spending comes from public resources. The rest of them are taken up by individuals. In terms of individual healthcare expending, 63.1% are out of the people's own pockets and 21.4% comes from insurance. As at September 2024, the policies amount to 1.4 million under the voluntary health insurance scheme. We see an increase in the number, but it doesn't mean that there is universal health coverage. People are still relying heavily on the public healthcare system, and there has been calls for reforms of the private healthcare system. The Consumer Council this March released a report on confidence as well as value in relation to healthcare prices. The report shows that there are challenges to increase price transparency. Since 2016, the SAR government has been working with the Hong Kong Private Hospitals Association to roll out a pilot scheme to enhance price transparency. That includes providing a price menu from the private hospitals, and there should be statistics under the pilot scheme. I visited the platform of the pilot scheme myself, and the price menu offered are quite practical, the statistics as well. This allows people to have a better understanding of the fees and charges of private services. However, there is a lack of exposure of the scheme, and there is room to improve the publicity effort. Some people have no idea that this platform exists. In Victoria, Australia, there is an online platform called Medical Cost Finder, and it provides information about fees charged by private institution. With straightforward wording, it provides a comparison of the fees and charges of different private doctors. It also provides information about the different stages of treatment to allow patients to have a better understanding of the fees and charges to help boost patients' confidence. I'm happy that this May, the government submitted a paper to LegCo which proposes to increase price transparency of private services. There are 3 legislative proposals. This includes requiring private hospitals to provide a price menu, and that private hospitals have to provide a budgeting form to provide the estimates, and there should be statistics from private hospitals. I think these are great suggestions. I hope that the government will roll out the relevant proposals soon and that there will be wide publicity. Increasing price transparency will not only reduce disputes, but also help those who cannot have the expenses covered by their insurance. This can help boost people's confidence of the private services. We are entering an aging society. We see an increasing healthcare spending, so we have to face this together. Thank you.
Ms. Eunice Yung, I speak in support of the original motion of Dr. Lam on comprehensively promoting healthcare financing reform and making optimum use of public and private healthcare resources. This is an answer to the urgent demand for a reform, especially given the fact that we have an aging population and imbalance between private and public healthcare services. In March this year, the government announces fee reform in the public sector. The number of items have seen a fees adjustment. This is to implement the principle of user pay principle, and those with means should pay more. At the same time, those who are in need will be given help to ensure that they receive medical assistance as necessary. This is the first step. However, if we are to genuinely tackle the challenges we face, we need to have a diversified and comprehensive healthcare financing option. Just now I mentioned about those with means pay more. There are objections. Some think that it's inevitable that if you have the means, you need to pay more. They understand the difficulties faced by the government, especially in a time when there is physical difficulties. Those with means, when they pay more, they want more. If you are paying for public service at a price that is similar to that in the private sector, will they be happy? Will it help to improve service quality? While we want to enable those with means to pay more, we have to make sure that service quality and efficiency will be enhanced at the same time. Mr. Tang Fei talks about further promotion of digital healthcare. During the pandemic, there was a demand and development in terms of teleconsultation. In HA Go or in the healthcare system, we have a teleconsultation services. On different occasions, I have mentioned to government officials that when it comes to preliminary consultation, management of chronic illnesses, counseling, as well as dental consultation, they are all covered by teleconsultation. This shows that Hong Kong can move towards this direction. Technology can be used to address the problem of uneven resource allocation. It also helps those who live in remote areas or areas with an undersupply of healthcare services to get what they need. I urge the administration to actively promote healthcare services. A member said that, if you have used healthcare services, does it mean that you will have to pay more? Not necessarily the case. With the development of technology, it reduces the demand on manpower. It also enhances efficiency in terms of consultation, research and development. It enhances the precision in an operation. Of course, if state-of-the-art equipment is used, the fees may increase. But it may not have to be fully reflected in the price. We want to encourage startups or specialized technology companies to be daring in their R&D. It also encourages the government to use the results of the R&D. There is undercharging for services in the public sector. There is a legislative proposal to enhance price transparency in the private sector. Currently, there is a system to ensure that members of the public will be best informed in terms of prices and services. Your time's up. Mr. Benson Look. Madam Deputy, I thank Dr. Lam for moving the motion on promoting healthcare financing reform and making good use of public and private healthcare resources. I also thank members for moving amendments. Service quality and technology is of world class. However, in recent years, our public sector is facing challenges. We have an aging population, and the prevalence of various illnesses is of a younger age. There is a high subsidy rate on healthcare. The burden is increasing. In 2025, in the budget, the total expenditure will stand at $822 billion. Healthcare accounts for about 16% of it. That is about $120 billion. Just second to expenditure on welfare. Currently, the expenditure is paid by taxation. The burden is huge. There is no efficient diversification of financing resources. It may not be sustainable financially. According to the Health Bureau, the subsidy rate is continued to increase. Between 1989 to 1990, it stood at 36%, and now it has increased to about 10%. A lot of people rely on the public sector. You have to go through a lengthy wait. The middle class may not be able to afford the high price in the private sector, especially those suffering from chronic illnesses. Some people fall into poverty because of their illnesses. There is an excessive demand in the public sector. The middle class is caught between a rock and a hard place. There are a lot of discussions on sustainability of the healthcare services in Hong Kong. We have some suggestions. A lot of jurisdictions talked about turning healthcare into an industry. This helps to attract capital and resources into the healthcare sector, thereby strengthening it. In May, the BPA has published a study report. It is suggested that 7 industries related to healthcare should be developed. That includes healthcare tourism, healthcare education, Chinese medicine, medical cosmetic beauty and beauty industry. This will further inject an impetus into our economy. At the same time, there is room for reducing cost. We can reconfigure the allocation of resources. There is concern about administrative cost. The government should take stock to conduct a review on the cost efficiency of the various disciplines. There should be streamlining of various administrative work to cut down cost. This will alleviate the pressure on manpower so that the additional resources can be devoted to development of precision medicine as well as to patients who are in dire need. We need more collaborations. Half of the doctors work in the public sector. However, they take care of 90% of the patients. Of course, in the public sector, you have value for money services. Most patients go to the public sector. There has been a number of PPPs in place, say, for example, the chronic illness co-care pilot scheme and various other measures to help alleviate pressure on the public sector. We need to further promote public-private partnership. We need to enhance price transparency in the private sector. We need to boost the confidence of patients to use private sector so that more people will switch to the private sector. We use the PPP so that more patients will enjoy quality and affordable service. I so speak. Mr. Michael Tian. Madam Deputy, I've always been supporting healthcare reform. In our health services panel in May, I have spoken in terms of enhancement of the price transparency of the private healthcare sector. I support the motion as well as the amendments. There is one point, however, in Mr. Tang's amendment. That is, to mandate private healthcare facilities to provide all services at package charging. I have reservations. Well, sometimes when you fall ill, say a fever, you may have to do different tests to find out why. It will be difficult to make all services charge at package charging. If it's not included in the package, does it mean the patient will have to make a different choice? What the private sector can do is to explain clearly the various fees of tests so that the patient can choose. For a package service, then you have to know exactly what you need. If all services are to be charged at package charging, I won't be able to support it.
Mr. An Man-yu, Deputy President, we have an aging population in Hong Kong, and the public healthcare system is now bursting at the seams. It is imminent that we undertake healthcare reform. The reform, however, should be undertaken under the principle of public-private partnership so as not to transfer costs to grassroots citizens. Now, the DAB is of the view that we should optimize the use of resources and expand the healthcare safety net to ensure the fairness and sustainability of the system, and that nobody would be turned away because of lack of means. The government is about to raise the fees and charges for public services, including GOPC and A&E services. However, the economy is now in the doldrums. This will put a greater pressure on families, especially those with chronically ill family members. who frequently need to visit clinics for appointments. There is a lack of evening healthcare services in Hong Kong. There are 23 GOPCs providing evening services. Only one of them provide services on weekends and holidays. People have no alternative if they fall sick at night, but to go to the A&E department or to visit an expensive private clinic. This is a structural problem. If it remains unresolved, this will harm the underprivileged. The government should therefore provide better support, especially in districts with a higher demand. The GOPCs should operate later into the night. There should also be slots on weekends and on holidays to alleviate the pressure on the A&E department so that affordable public services can be provided to grassroots. After introducing the reform, the medical fee waiver scheme will also be covered. Now, my suggestion is for the work family allowance scheme and the beneficiaries under the schemes and the school textbook allowance schemes be included in the scope of the medical fee waiver scheme so as to prevent anyone from being left out of the safety net. Now, Deputy President, we now have a new opportunity for public-private partnership under the Clinical Disease Co-care pilot scheme. I fully support the partnership model so as to ease the pressure of the public health care. However, not many private doctors have signed up for the pilot scheme, just several hundred of them. According to patients, they sometimes need to travel to another district to visit a private clinic. The procedures are cumbersome. There is a lack of incentive for more private doctors to join. The government should streamline the procedure and provide more incentive. The scheme should be expanded to cover more categories of chronic illnesses. There should also be a step-up efforts to monitor the health of our children. At the same time, the government should encourage more private doctors to join the network of district health centers so as to improve primary care and make sure that the elderly and the chronically ill children can receive appropriate care. According to parents, because of limited desks available at the GOPCs, they need to take their sick children to expensive private clinics or the A&E department. The government should make reference to the booking system for children's clinic so that for children below the age of 18, they can make a booking with the GOPCs so that they don't need to crash at the A&E department. The crux of the healthcare financing reform is to ensure sustainability and to avoid the underprivileged from being driven out of the system. We need to optimize the use of public resources so as to make the system sustainable. The government should continue to optimize resource allocation and promote public-private partnership. Next, Mr. Tony Jay. Deputy President. As pointed out by the Secretary just now, even before 1997, we began to discuss healthcare reforms. In 1999, the Harvard report was published. It was about healthcare financing reform. The report points to various problems facing the healthcare sector, including an aging population, acute shortage of healthcare manpower, imbalance between public-private healthcare, as well as inflating healthcare spending. According to the report, unless reform was undertaken expeditiously, over 20% of total healthcare spending will be incurred in the future. The then Secretary for Health and Welfare described this level of spending as unacceptable and it will also compromise other aspects of public spending. The report came with various recommendations such as a joint contribution system, a mandatory medical insurance, so on and so forth. For various reasons, these recommendations were not implemented. Now, the public healthcare spending nowadays has reached a level that is not acceptable according to the then secretary, and the government has run into a serious deficit. One important reason why the recommendations were not taken seriously is because of populism. We have had imbalance in the public and private healthcare sectors, with the private sector charging daily for the services. Many immigrants actually come back to Hong Kong for medical treatment because of our quality public healthcare services. Now, with limited resources, this means a longer waiting list for non-urgent treatment. In the past, on numerous occasions, the government and the hospital authority proposed to increase fees and charges for public services. And every time they were heavily criticized by political parties, council members, and the public for sacrificing the grassroots, especially when the proposal was floated near elections. In the end, waiting time gets longer, resources are wasted on administrative procedures, and now the government coffers are in such a position that the government is bursting at the seams. There is also protectionism of the healthcare sector. Over the years, we have proposed various measures, such as introducing non-locally trained doctors, making better use of Chinese medicine, and also supplementary medical professionals. And over the years, whenever these proposals were floated, there was filibustering in the council, and that's because of the vested interests of certain factions. Now, Secretary, you are a medical doctor, and I believe that you will also put the interests of patients and the general public first. This term of government has introduced a number of reform measures, such as relaxing the criteria for non-locally trained doctors to practice in Hong Kong, promoting Chinese Western medicine collaboration and primary care, so on and so forth, along with the public healthcare fees and charges reform. I see the government's commitment in tackling challenges. So I'd like to take this opportunity to appeal to the general public and council members, as well as medical professionals, that we should all put the interests of patients first, so as to be visionary and consider all the reform options. Next, Mr. Chan Yong. Thank you, Deputy President. Thank you, Secretary. Now, my suggestion is to enhance speed and efficiency in undertaking healthcare financing reform, and we should optimize the use of healthcare resources, especially leveraging on the resources available in the Greater Bay Area. I thank Dr. David Lam for moving this motion. I also thank members including Edward Leung, Bill Tang, Dr. Hoey Lee, and Mr. Pui-leung for their amendments. I'm a member of the DAB, and my fellow member already gave a very detailed analysis. Now I'd like to make a supplement. The life expectancy of Hong Kong people tops the world, especially for ladies in Hong Kong, followed by men. It has to do with our robust healthcare infrastructure. But like our Chief Executive, Mr. John Lee, said, that there is always room for improvement. Against the backdrop of an aging population and escalating healthcare spending, we need to find a way out. This is a crisis. According to President Xi, we need to put people's health first is an indication of the civilization and progress of a society. It's also a foundation for building a strong nation. The policy address of the Chief Executive also refers to a holistic review of the healthcare system. So I fully support the Chief Executive. We do have good infrastructure. We have hospitals, but we're short of doctors. The waiting time for medical services is too long. We have some world-class doctors practicing in Hong Kong, including the Secretary. So I support what Dr. David LAM said in his motion. But we also need to help the underprivileged. I want to talk about their difficulties. According to media reports, for some services, the waiting time could be as long as 111 weeks. For minor surgeries such as hernia repair, in a public hospital, the waiting time is 6 years. We have just 2.1 doctors per 1,000 in the population, far below the average 3.6 doctors, according to the OECD standard. Now, I've been told by senior citizens that when they queue up for major operations or specialist outpatient services, they are often in tears while waiting for the service because they might not get the service before they die. My other suggestion is that we need to promote cross-boundary collaboration. Now, as mentioned by other members, we need to leverage on the medical services available on the mainland. We have quality 3A hospitals in the mainland. I think the hurdle is about medical insurance, but nowadays we have cross-boundary insurance coverage. There are experts in this council as well. And according to my friends, it's now possible to buy cross-boundary or take out cross-boundary insurance policies. Even cross-boundary ambulances are available. All these are facilitation measures. We have some 500,000 Hong Kong residents living in the mainland. So another option should be given to our people so that they can use the GBA services. This will help us form a closer tie with other GBA cities, and that we can focus valuable resources in Hong Kong to help the most in need, such as the chronically ill and the elderly and the frail citizens. This can be implemented in a short period of time. I hope the government and the Secretary will give it a thought.
謝謝主席，我喺度咧發言支持林志源議員提出嘅全面推展醫。
Ms. Connie Lam, thank you. I speak in support of Dr. David Lam's motion. Hong Kong can become one of the longest living cities in the world because we have a safe, reliable, and convenient public healthcare system. However, in future, we will see a serious population, aging population problem. And this will aggravate the imbalance between the public and private sector. So this reform addresses our needs. However, this reform has sparked controversy. This is not about fee adjustment. Instead, we will see an increase in terms of other types of services. This will affect our sense of well-being and sense of gain. the government should not only focus on the charging of services. I thank Dr. Lam for proposing this motion so that we can have a full discussion of the effectiveness of the public-private partnership model. I think we should use the most effective way to divert patients to appropriate services. For example, for those with minor illnesses, they should go to the district level. And for those with serious illness, they should be brought to the public hospital. The amendment mentions that private healthcare institutions should provide services at packaged charging. I think the government should explore this so that there could be a clearer charging model. If packaged charging is made mandatory, it could deprive people of the choices they have. The 2025 bill in relation to e-health record sharing has completed its scrutiny. And this allows healthcare practitioners to obtain information about patients. This can increase accuracy as well as continuity. The newly added cross-boundary system will allow Hong Kong people who go to the mainland very often to get seamless services. With greater price transparency, members of the public can have a better grasp of the fees and charges of services. We need a series of measures, and they will complement each other. We need to educate our public on how they can make use of the e-health system. In the long run, the government should expand the sharing of health record between public and private healthcare sector to the Chinese medicine sector to boost efficiency. Well, since 2014, we've seen the integration of Chinese and Western medicine, and I think we can learn from the experience. I want to make psychiatrics as an example. In 2022, there was a pilot scheme in the HA cluster, and then it was expanded to all clusters under the HA. We have over 960,000 patients participating in the who need the psychiatric services, but only 50-some people were referred to the services. And for each service, it only cost about $50, and doctors only receive about $300. Those doctors who took part in the scheme every year, they can get some $3,000 of service fees. So some doctors told me that they would not join the scheme even if they are invited. If this scheme is not effective, should it be revised? I hope the government can review the scheme and talk to the stakeholders to review the effectiveness and appeal of the scheme. Please take on board my suggestions. I think there should be a co-payment and public-private partnership model for psychiatric patients to reduce the waiting time for patients and to reduce the expenses. Thank you. I so submit. Mr. Tommy Chung. Thank you, Deputy President. This debate is about the fee reform announced by the government earlier. And this is about the healthcare financing reform. There are three major points. First, in March, there was the fee reform proposal rolled out, and in May, on the panel on public health services, there was a legislative proposal concerning increasing price transparency of private services. And thirdly, there should be discussion about health insurance. Well, 5 minutes is not enough to cover all my points. Earlier, the Liberal Party conducted a questionnaire survey. 1,600 some questionnaires were received, and the results show that over 50%, that's 51.4% of the respondents, agreed that A&E services have been abused, but over 53% of respondents agreed with the reform. That is to increase A&E service fee to $400 for general outpatient clinics as well as specialist out-cleaning service. The fee should be adjusted upward as well. Nobody would want a fee increase, but the fee increase this time is significant for the public. The government is facing a fiscal deficit, and it hasn't been adjusting the relevant fees for a long time, and there's been a abuse problem. So it's understandable that the government is trying to roll out this fee reform to tackle a number of issues. Well, after the rollout of the fees reform, we think that the government should also make the cap as $10,000 for public hospital services. According to our survey, people use public services once every 2 to 3 months, and the expenditure does not go over $10,000. Well, I think our party should not be over-worried, and we think the government should implement a fee waiver mechanism. It should expand the safety net for the relevant service to help those with financial hardship. The relevant application procedure should be streamlined, and the evening consultation services should be extended so that it gives flexibility for patients to have access to these services. After the fee reform, the gap between the public and private sector is narrowed. For private clinics, the consultation fee costs a few $100s. Well, people generally understand that the medication offered by private clinics are better, so the medication is more expensive. We think that private healthcare institutions should increase the price transparency. I've said a number of times in this council, and I learned from the experience of my friend that the charging situation is serious. Private doctors or specialist doctors in private hospitals, they do ward rounds once or twice every day, and this costs extra. I was able to help my friend to reduce the cost, but still the total cost about $300,000 for all the services for my friend. Lastly, on the indemnity system, we encourage people to take out voluntary health insurance, and we think that there should be more subsidies from the government. Also, our party supports the idea of having personal savings accounts. We support the proposal made by Dr. David LAM, but we have reservations about the proposal made by Mr. Bill Tang, so we will claim division during the vote. We think that services should be provided at packaged charging still. Time is up. Dr. So Chuan-Wing, Deputy President. We have great healthcare services in Hong Kong. However, we see imbalance between the public and private sector. For public services, they are cheap, and they adopt a human-centric approach. As a result, near 90% of our citizens rely on the public healthcare system. And those serving under the public system, well, these doctors, they account for 46% of all doctors. And we lack facilities in the public system. Therefore, patients need to wait for a long time for public services, especially for non-urgent specialist services. There have been many complaints. This current term government is determined to roll out a reform. It strives to come up with strategies to divert patients to the private sector. Dr. David Lam's motion as well as other members' amendments help the government roll out the reform. Professor Low, our secretary, explained the roles of the health department, the hospital authority, as well as our family doctors. The government has rolled out the chronic disease co-care scheme to subsidize people to undergo screening in private hospitals for diabetes, high blood pressure, and so on. The government suggests that there should be increased price transparency. It has also announced the healthcare fee reform. The key is to divert patients to the private system. It is also to have people pay more for their own healthcare expenditure. This is to address the imbalance, and this is also to make the pay level more reasonable. We need to adopt the affordable users pay principle, and we need a fee waiver mechanism. I have the following suggestions. We need to build a safety net for the grassroots. The government needs not only take care of the underprivileged, but also has to ensure the basic rights of the grassroots. Some grassroots elderly, they're not in poverty, but they may find the reformed fees too high. There should be a fee waiver mechanism to draw a line in terms of the payment level for the grassroots. Second, there should be voluntary insurance scheme to encourage people to take out insurance to get private services. There should be increased transparency in terms of the indemnity level provided by insurers. Thirdly, the legislative procedures for increased price transparency of private services should be sped up. There should be a mechanism to regulate packaged charging. Fourth, we should expand the public healthcare system and improve the public services. We should also have more hardware and software facilities for the public healthcare services. Fifth, more chronic illnesses should be included in the chronic illness co-care pilot scheme. I so submit. Thank you.
Dr. Chow Siu-chung. Madam Deputy, I speak in support of Dr. Lam's original motion as well as the 4 amendments. The government announced the fees reform in the public sector. To the general public, they think that there is a huge increase for visits at the A&E as well as general and specialist services. For those who are in need, this is a huge financial burden. There may be a cap protecting patients from falling into poverty because of their illnesses. However, the administration said that unless you have a critical illness, you won't pay more than the cap. For self-finance drugs, the means limit will be relaxed under the Samaritan Fund. The number of eligible persons for waivers will increase from 300,000 to 1.4 million people. To a certain extent, the underprivileged will be protected. They will receive medical treatment and will not be denied that because they don't have the means. Well, currently, we have about 97% of subsidy rate. Recurrent expenditure on healthcare stands at about $170 billion. This current mode of financing is not sustainable. We need to have reform to make sure that resources is used on a targeted way as well as to reduce wastage. I have received a lot of inquiries from grassroots after the reform has been announced. A lot of people from the grassroots will have to seek evening consultation service. They don't go to the private sector because they don't have healthcare insurance. In the end, they go to the A&E. I asked the administration to increase the quota for evening service so that there will be an affordable option available. To start with, maybe you can extend the service hours over holidays. There is an imbalance between the private and the public sector. Half of the doctors work in the public sector, but about 90% of patients go to the public healthcare system. You can imagine how heavy the burden is. Patients needs to be guided towards the private sector. More people should be encouraged to take out VHIS. There should be an increase in the allowance for premium paid under the tax allowances. In the private sector, the service quality varies. Charging also differs greatly. For just a cotton bud, you're charged differently in different hospitals. Patients don't know about the basis for charging. With so much uncertainty, of course, people are discouraged from taking out insurance policies to enable them to go to the private sector. They will stay in the public sector. I support the government's proposal to legislate to enhance price transparency in the private sector. More institutions in the private sector should offer package charging and package services. More information should be made available for patients to make an informed choice. I so submit. Mr. Kwok Wai Keung. Madam Deputy, I speak in support of the original motion and all the amendments. We have an aging population. It is an urgent problem. The problem will only grow. With that, there will be an increasing demand for healthcare services by elderly people. We need to strengthen our healthcare service to handle this problem. For a new case, you'll have to wait for at least 2 months to see someone in the public sector. The coverage of district healthcare centers is poor. Elderly people in the grassroots sector don't want to go to the private healthcare system. The government needs to make good use of existing resources, to make better use of their technology, and to reform service delivery. It's not about whether to do it or not, but how to do it. There is no choice. We need to remove the obstacles in the home stretch towards a district pharmacy. But there are only 10 pharmacies for 500,000 people. That means each will have to serve about 50,000 people. The effectiveness is doubtful. There is the HA Go drug delivery service. You only have to go to the app and then you get your drug delivered the next day. But there are difficulties in actual operation. First, timing. 2, digital gap. Elderly people are not tech savvy. The HA Go service is not fully utilized. The FTU has been supporting the work of platform workers. They are delivery workers. If elderly people can receive their drugs delivered at their home, perhaps more can be done. Delivery workers can deliver drugs as well. Some members talked about the fees reform. They say that it puts a huge burden on certain sectors of people in society. How do we help them to overcome the difficulties they have? Well, for specialist outpatient unit, the fees is increased from 80 to 250. Sometimes it's just to see the doctor to get a brief comment for report. You wait for 2 hours and you see the doctor for about 3 to 5 minutes. A lot of people asked if they can not go to the follow-up session. You have to. We can make use of smart initiatives, say for example, teleconsultation. The doctor probably will tell you that your report result is good, you only have to go get your medicine. Then you don't have to travel to see the doctor. Cross-boundary elderly service is one thing. A lot of people who are living in mainland residential care homes would like to use drugs in Hong Kong. So you need to explore about how to deliver drugs to mainland residential care homes. We need to enhance the price transparency in the private sector. If insurance becomes part of the healthcare financing, transparency as well as regulation should be enhanced. So far, no one knows how much profit insurers make. If that's unknown, then we cannot make sure that public funds are properly used. Your time's up. Mr. Kingsley Wong. Thank you. The government launches the fees reform. They also propose to legislate to enhance price transparency in the private sector. The goal is to ensure that there is service quality as well as sustainability to tackle problems brought by the aging population. No matter what we do, we have to make sure that the poor, the seriously ill, and those who are in need, those with acute illnesses, are assisted. At the same time, we have to ensure that those in the middle class will save money. Starting from the 1st of January next year, well, you pay currently $80 and $125 in total for drugs as well. So $300 or so over a year. Next year, you'll have to pay $250 for consultation and $240 for drugs. So each consultation is about $400 or so, and you pay over $1,700 over a year. The administration said that an additional 110,000 people will be eligible for waivers. According to our survey, half of the people don't know that they will be eligible for a waiver. The majority of the people who will become eligible are automatically added. Well, you can lower the threshold for elderly people from 75 to 65. If you rely on medical social workers to process applications, then you need at least double the amount of manpower. You need to expand the channels to help with application processing. A&E visits will see an increase in fees from 180 to 400. This is to discourage people from using the A&E service for minor illnesses. But a lot of people say that there is not enough evening service. They have no choice. That's why they have to go to the A&E. So in addition to increasing the service capacity of evening service, can the administration allow private clinics to open for services near A&E departments? Well, in terms of a procedure, OGD, you will have to pay for about $20,000. For endoscopy, you have to pay for about $150,000. The administration encourages more package charging as well as package services in the private sector. This will provide certainty when you use private services. There has been some breakthroughs in the international community. On the mainland, they have used a newer standard. There will be a standard in the Greater Bay Area. Perhaps subsidy can be provided for patients to use services in the GBA. This will be another option. This will in turn reduce healthcare expenditure. Hospitals may have bargaining power, but it will not be as much as that of a country. There is a patient suffering from intestinal cancer. Medicine alone costs $20,000 a month, but it will only cost you several $1,000s on the mainland. So in addition to lowering the threshold for applications for waivers, there should be additional subsidies. We can also promote the use of usage of good drugs in Hong Kong. Assistance should be provided to help patients to procure drugs on the mainland as well.
主席，
Ms. Chen Yutming. Thank you, Deputy President. I speak in support of this motion debate on comprehensively promoting healthcare financing reform and making optimal use of public and private healthcare resources. There is a serious imbalance between public and private healthcare in Hong Kong. According to statistics, the grassroots families have been relying heavily on public healthcare services, and the total public healthcare spending amounts to 2/3. But there is a need to triage the demand for inpatient and outpatient services to the private sector, so as not to compromise the service quality of public health care. Now, I have two suggestions. The first is to enhance price transparency and better triage patients. The government rolled out the voluntary health insurance scheme in April 2019. The VHIS is similar to the annuity plan. The government provides proper safeguards. It also supervises the insurers. They must abide by the rules and requirements in relation to sale and promotion, etc. Tax deductions are also offered. According to statistics in 2023, VHIS products now took up 1/3 of the total market share. Well, I think that market transparency should be further enhanced. There should also be rules drawn up for the insurance industry to give the public greater reassurance in VHIS products. Medical insurance is tax deductible, but if there is a lack of price transparency, the public will still be very cautious in going to the private clinics. In 2024 policy address, the Chief Executive proposed public health care fees and charges reforms was to enhance transparency and provide the public with affordable options. In May, the Hospital Authority and the Health Bureau briefed electoral members on details of the reform. So I think this will help boost public confidence. The second point is integration of boundary economy and development of private hospitals. In the northern metropolis, especially in Gauteng, May, NDA, land has been reserved for the third teaching hospital in Hong Kong. Now, the Baptist University, the Poly-U as well as UST have already submitted proposals. So our universities are responding very positively to the development of the third teaching hospital. There should also be proper planning so as to make sure that the boundary economy concept can be supported. After resuming normalcy in 2022-23, mainlanders have come across the boundary to take out insurance policies. So one idea of promoting boundary economy is to provide high-end medical and financial insurance services. At the Aotame Teaching Hospital, we can build a special unit to serve mainland clients. There should be joint development between the insurance industry and the development of private hospitals so as to improve the operation of these hospitals. Mr. Kisanyang. Thank you, Deputy President. I thank Dr. David Lam for moving this motion on comprehensively promoting healthcare financing reform and making optimal use of public and private healthcare resources so that we have this opportunity to discuss this topic. Now, we are short of medical resources, especially for evening services. The clinics usually close at 10 at night. In my constituency in central Kowloon, members of the public feel helpless. They have no alternative but to turn to public hospital at midnight. There is imbalance, especially in terms of evening services between private and public health care. More should be done to address this shortcoming. On optimizing the use of public and private healthcare resources, I have two suggestions. First, more incentives should be provided for private doctors to operate at night. The HA emphasizes public-private partnership. The private doctors are encouraged to provide evening consultation services to share the burden now put on A&E department. We do not have a lot of private clinics offering this service at night. The government should provide incentive for private healthcare service providers to extend their service hours. The government should also put in place a recognition scheme so that family doctors signing up could be given priority in terms of various medical resources such as telehealth services or smart health equipment. Priority can be given to these family doctors as an incentive. They can be asked to join the Committee on Primary Care so that they can help formulate policies together as an incentive. Then more private doctors will sign up. There isn't any concrete measure on encouraging private clinics to offer evening consultation services. Now, I suggest the government set up KPIs for service delivery and enhancing the services at night. According to the HA, for GOPCs, they offer daytime consultations. Even for the evening sessions, they run from 6 to 10 p.m. only. In the middle of the night, there is a big gap. We must leverage on the private sector to ensure public services are delivered. The government should also provide financial incentives in the form of reward or otherwise rental subsidy. so as to encourage private doctors to set up practices offering evening consultations in densely populated districts. My other suggestion is to enhance telehealth services for hospitals offering night consultations. They are not manned by sufficient doctors. The waiting time at night is particularly long. The government should enhance the quality of teleconsultation services at night so as to allow patients to stay home and receive services without getting out, and this can help plug the gap. We can also put in place better triage system and allow those who are seriously ill to have priority in A&E services. Now, after COVID, we're now used to telehealth services. In other places, such as Ontario in Canada, virtual A&E units have been set up so that critically ill patients will not be required to wait a long time at the A&E department. We are just taking the first steps in terms of telehealth. This is supported by doctors and patients alike. In light of the long waiting time in public hospitals, the government should consider launching virtual A&E services at public hospitals. For patients who are not critically ill, they can receive teleconsultation online. Now, these are suggestions on addressing the resource restraints and the lack of evening consultation services in Hong Kong. Mr. Dominic Lee. We are facing an unprecedented challenge as far as the healthcare system is concerned. We have an aging population, and the medical costs have continued to escalate. This is a bottomless pit if we rely on the public coffers to support the delivery of public health care services. It is not sustainable. There is a problem with resource allocation, and more importantly, it is a crisis in terms of healthcare financing. I thank Dr. David Lam for moving the original motion. This is an urgent issue. I thank him for giving us this opportunity for a discussion. We need a comprehensive and visionary blueprint to ensure that the system will remain robust. The New People's Party supports the original motion. In order to address healthcare financing, we should introduce a concept of co-payment. We also should enhance the role of personal medical reserve. In Singapore, they have the 3M concept. In particular, there is a medical savings scheme. It's a mandatory arrangement for those in the workforce to keep a certain portion of their income in a savings account. The account can then be used to pay for medical expenses of the account holder as well as the family members. A personal medical financing pool can be set up to pay for the unexpected medical expenses. The other merit is that we can help people save up and be responsible for their own health. So I think the government should look into this option and see whether this can be incorporated in the MPF system. Apart from a personal reserve, commercial medical insurance is also another important pillar. The government has rolled out the voluntary health insurance scheme. Despite all the goodwill, it seems that there is a lack of publicity effort to encourage the middle class to turn to private health care. As pointed out by Ms. Chen Yut-ming, only slightly over 10% of patients have turned to the private sector. I think it has to do with a lack of uncertainty in insurance claims. citizens are deterred because of the hurdles in filing insurance claims. So I think the government, first and foremost, should work with the insurance industry and roll out a VHIS 2.0. That is an enhancement version. For common surgeries and treatment procedures, standardized charges and fixed price claims should be set out so that there is clarity. The other suggestion is to extend the financing tool to the Greater Bay Area. For example, the government can take the lead and set up a cross-boundary healthcare insurance settlement platform, so that if you go to a 3A hospital or a Hong Kong Shenzhen hospital across the boundary, you can still use the VHIS and then claims can be settled automatically under this mechanism. This will give play to the function of commercial influence and take pressure off the public healthcare system. Healthcare financing is crucial to an overhaul of the healthcare system in Hong Kong. The government must not shun the problem. As long as the government is committed to making breakthroughs and be innovative, I'm sure that we can resolve the problem through undertaking reform in the two directions. We must build a new financing model with the involvement of public and private sector so as to ensure sustainability of the system.
Mr. Stanley Lee. Thank you, Deputy President. I support healthcare financing reform. I thank Dr. David LAM for moving this motion so that we have the opportunity to discuss this here. In the next 10 years, patients with chronic illnesses will account for 37% of our total population. We'll see greater burden on our public healthcare system, so we should not wait any more to roll out a reform. However, it is not easy for people to accept changes. For years, people have been used to the existing system. For example, we're always told about the healthcare spending of people. I hope the government will take into account public's acceptability when revising the fees and charges. I think we can work on the two following areas. First, we should introduce smart medical technology such as electronic appointment system, telemedicine platform, big data management for patients' history and record. The Secretary brought us to the mainland hospitals, and we saw that a lot of the procedures have become smart. However, in Hong Kong, we haven't been able to make use of smart technology in our dispensary services and so on. Well, I serve residents in Ma On Shan, and it's quite densely populated. There are general outpatient clinics that have been serving the residents for a few decades. Would the government consider expanding the public healthcare services in the district? Of course, the government will have to first see whether it will offer help to the local residents. Will the government expand public services by extending the operating hours of the clinics to the evening, for example? Also, the government can do more in promoting public-private partnership. Well, people in general like private healthcare services. However, my office got complaints from a citizen. The citizen got a very heavy bill after receiving a surgery in a private hospital. However, that private hospital concerned did not reveal the exorbitant amount to be charged beforehand, and there wasn't a detailed risk assessment report for the patient. Now, the patient has received the surgery, but the fees have not been paid. And we got the complaint from the patient. I tried to contact the private hospital concerned, but this hospital refused to talk to me on the phone. The hospital engaged a lawyer, and I tried to talk to the lawyer. Again, this lawyer firm refused to talk to me. Instead, they wrote to me. Well, normal citizens have found it hard to deal with these situations. It's not uncommon to have these complaints over the past 5 years. The Medical Council dealt with over 8,700 complaints. On average, each case takes 27 months. Some cases, they need 4 years to finish the disciplinary procedure. For more complicated cases, they take longer. According to the Consumer Council, from 2021 to 2024, 191 complaints were received in relation to healthcare services involving over $7.2 million. This shows that there is a lack of price transparency of private healthcare services. I think there needs to be improvement in this regard. For example, there should be a budgeting plan or a regulatory mechanism. I think we need to take the first step first to ensure that we offer reliable healthcare services to our people. Ms. Judy Chen. Thank you, President. I want to first thank Dr. David LAM for proposing this motion on comprehensively promoting healthcare financing reform and making optimal use of public and private healthcare resources. We are given the opportunity to discuss how we can further improve our healthcare policies so that citizens, when they're faced with health conditions, they won't feel helpless because of the exorbitant cost. Our healthcare system is quite advanced. However, for years, people have concerns about the healthcare cost. People from all walks of life, including those from the grassroots, they need healthcare services. We also have elderly people, and we have patients with chronic illnesses, and they rely heavily on the public healthcare system. Any change to the healthcare system is very sensitive for these people because this will alleviate, give greater burden to them. Our public healthcare system for a long time suffers huge pressure. We've been talking about the long waiting time for A&E services and the lack of healthcare manpower. There has been an imbalance between public and healthcare services. This has been a long-standing issue, and people are anxious about this. I very much agree that when we roll out a reform, we have to think about how we can distribute the resources and how we can strike a balance to address people's concerns, to protect patients' rights and interests. I think there needs to be a series of reform. The government has been improving the fees and charges system to ensure that there is a reasonable distribution of our healthcare resources. The government has also introduced the affordable users pay principle to ensure that our healthcare system is sustainable and that people with the greatest needs can be taken care of. We also see improvement in the fee waiver mechanism. The mechanism has been expanded to cover more people. This also helps ease the financial burden of a lot of families. Public-private partnership is important. Through the partnership model, we can use our healthcare resources more effectively. This can address the problem of the lack of price transparency as well as medical inflation. This will make healthcare services more affordable for people. The government has implemented a number of measures. I hope the government can further increase the price transparency of private healthcare services so that patients have a better grasp of the relevant information, so that they don't have to suffer further financial burden because of a lack of information. Healthcare is an issue of concern for a lot of people. I know that the Secretary has been working very hard to build a fairer and more sustainable public healthcare system and a more transparent platform. So that people will not be deprived of medical treatment because of a lack of means. Thank you. Mr. Paul Che. Well, we've been talking about the issue of transparency. Dr. David LAM's motion is about the transparency of health insurance claims. However, Mr. Edward Leung and Mr. Pui-leung expanded the scope of discussion to talk about the price transparency of healthcare services. There are two different matters. One is about health insurance claims, another is about the price of private healthcare services. On the 6th of March, the Consumer Council released a report saying that between 2021 to 2024, 191 complaints were received, and they were about the lack of price transparency of healthcare services. And there have been some suggestions made. For example, package charging, as suggested by some members in the amendment. In the past, package charging was regarded as a taboo. But now, with advancement of our society, we've been talking or calling for package charging. I think we need to leverage on market forces. We need more promotion. Well, doctors and lawyers are no longer regarded as the top-level professionals. And across the boundary, on the mainland, we have had these services. And so if we do not reform, we will lose all the patients. Also, we need mandatory packages. Well, it's been implemented in some places already. Well, I don't agree that we should have a mandatory package charging scheme. It should be a voluntary one. Doctors are quite conservative. Between doctors or between doctors and patients, we could have sharing of information, but there shouldn't be misleading information, and the promotion shouldn't be exaggerated. This is understandable. When we get to the right of know of patients, well, it is like a black hole. There's been a lack of publicity. It could be because it would make the industry look cheap. Let's look at another industry. Well, doctors are always regarded as a high-level professional. Well, lawyers too, so advertisements are not allowed for these two types of professions. But starting from 1997, relevant promotions or publicities are allowed. In the past, we only allow advertisements that is as large as a stamp, but now we can have a whole page of ads. this kind of regulatory mechanism has been effective. We have a higher level of transparency and we have more information. There is also more packaged charging. Well, I'm the first one doing this. So I hope that we can relax the restrictions. Package charging may not be able to apply to all types of services, but for endoscopy, for example, we can have package charging so that there could be agreed prices between patients and doctors. It's like in the legal sector, we need agreed prices between clients and lawyers. If we do not reform, we will lose all our patients to the mainland. So we need to leverage market forces to increase the transparency. We need to allow patients to know what their rights are. It is not acceptable to have access to all this information when we get to the hospital.
Ms. Dari Lee, first of all, I'd like to thank Dr. David Lam for moving the motion today. We have an aging population. We have advancement in medical technology when it comes to tests, treatment, drugs, equipment, as well as health food. We've seen improvements. When it comes to reform, it's a long-standing discussion. I'm sure the discussion will continue because we're talking about who pays more and who will receive less. I think it's very difficult for us to reach a consensus on this controversial issue. Members talked about the NHS is a mess. In the US, it's no better. Every time there is an election, healthcare is one topic that will always crop up. Say, for example, Obamacare. I actually am glad that we'll continue to have this discussion. Reform is something that we'll continue with as well. I really appreciate the Secretary for his determination and bravery in the face of challenges. I may not support you every single step of the way, but I do recognize your determination and your courage. Previously, there was the fees reform. I must do my duty and reflect to you what the comments I have received. We agree that there is the need for reform. The fees themselves have not been adjusted for a very long time. For some items, it's on the low side. I think there is a strong view towards the level of fees when it comes to specialist services. I understand that the scope of subsidy has increased for certain beneficiary groups. We do our best to publicize the result of the reform. But as I've said, when you have raised the fees, some people will not agree to it. You need to work harder when it comes to publicity. You need to pay attention to the financial burden on the general public. We have to do something. It is a difficult journey, but in any event, this is a step forward. I want to talk about how to address the imbalance between the private and the public healthcare services. I see that there is an increase. Currently, there is about 1.34 million insurance policies taken out. Is an improvement. I echo what Mr. Paul Chair said. How do you make the middle class and the sandwich class more willing to go to the private sector? Fee, transparency, and certainty are important. I sometimes go to a private clinic or a private hospital without knowing how much they will charge. Well, for outpatient, you know because it's on the website. But for some doctors and some services, you only know how much it will cost you when you receive the bill. If you want the sandwich class and the middle class to change, then you need to give them certainty and transparency. Making package prices for all services mandatory is ideal. But can it be done? Different doctors have a different charge, and the conditions of patients are different. Well, there can be a range of fees for reference. Maybe an acceptable margin of 10%. Or at least you can give us an explanation. Give us some idea, some kind of certainty to make it easier for the middle class to swallow. I would like to now move on to the use of technology. Cost is an issue. We can have teleconsultation or a central pharmacy to buy drugs to address urgent issues. More important is knowledge. If you can do all that, then the pressure on evening service will be reduced. Mrs. Regina Ip. I speak in support of Dr. David Lam's original motion. In relation to the amendments of other members regarding the one from Mr. Edward Leung and the one from Dr. Hoey Lee and Mr. Chen Pui-leung, the New People's Party have no issues with them. When it comes to the bill from the amendment from Mr. Bill Tang, we have reservations. I will explain. Healthcare financing is a thorny issue. It's been plaguing us for a very long time. Back in 1999, there was the Harvard report published, as the secretary said. Before the publication, back in the colonial days, the government knew that with the imbalance between the private and the public sector, the healthcare system is unsustainable. But when it comes to reform, you touch a lot of nerves. You have to tread very carefully without making any overhauling moves. In the last term of the government, there was the launch of private insurance. I'm glad to learn that about 1.4 million policies have been taken out. However, we have an aging population and we have medical inflation. There are more new equipment, drugs, and procedures. The expenditure will increase. A lot of countries, say the US, face a huge problem from healthcare inflation. Our system mirror that of the NHS, the National Health Service. A lot of services are free of charge, but we've done too well. There is an over demand. If you have someone living in the US, you know that the NHS is on the brink of collapse. Well, there are a lot of people leaving the system, seeking help somewhere else. There has been a number of reforms announced by the Health Bureau. I would like to give recognition where it's due. First is the 1+ mechanism. I think it will drive down the cost of medication. We have expedited the mechanism, so there's pressure to reduce a cost of drugs. There is another one. There isn't much publicity, but it's called IMACE. The Institute for Medical Advancement and Clinical Excellence. I only learned about it on the 8th of May from the press release, but I had no idea what it was, just reading from the press release. Relying just on a press release alone is not enough when it comes to publicizing government policy. I only know more about it from the explanation of the secretary Well, we have two universities, the Hong Kong Private Hospital Association, as well as a number of parties working on the establishment. There will be information as to what procedures are needed. When you claim insurance with a private hospital's bill, using this guideline from the Institute, then the insurance company will know whether you've been asked to do something unnecessary or whether you have not received a necessary procedure. I hope that it will gradually enhance fee transparency so that money will not be spent on unnecessary items and patients will receive what they need. Well, under the fees reform, there is a lack of details when it comes to waivers. When the government deepens healthcare reform, perhaps they need to consider how to better explain about their policies. In relation to Mr. Bill Tang's amendment, we talked about making something mandatory. It's very difficult unless you do it by legislative amendment. I'm afraid the New People's Party is unable to support that part. Mr. Jimmy Ng, I have a friend who's just retired for 2 years. He loves to plan. He saved enough money for his retirement. At the beginning of the year, he went through a health check. He was at the initial stage of a serious illness. There is a new drug available to save him, but it's an expensive drug. My friend's worrying about how to do it. There are numerous similar cases in Hong Kong. When you get old, you have to pay through your nose for medicine. The middle class find this unaffordable. Well, we're renowned for our healthcare services. It's affordable and high quality. Most Hong Kong people use it. This brings a huge expenditure. We have a private sector, but there is a serious imbalance. Reform is inevitable. We need to vigorously guard against the expenditure to make sure that it's well spent. We don't object to that. But who decides who are in need? Those at the grassroots? My friend is a case in point. There is that people who are middle class have great needs too. We have to do things with precision. We have to carefully vet the expenditure and, if necessary, consolidate certain disciplines. We also need to streamline administrative procedures to reduce costs, make better use of technology. All these will alleviate manpower pressure. Resources will be used on those areas and patients who are in greater need. Is it the case that we will just be thrifty and economize? No. At the same time, we can increase source of income. At the end of last month, the BPA has announced a study report talking about developing 7 healthcare-related industries. First, biomedicine. 2, pharmaceutical industry. 3, healthcare equipment. 4, Chinese medicine. 5, healthcare tourism. 6, healthcare education. 7, cosmetic medicine. The government will take the lead. Various measures will be put in place to promote development. That is an important area of reform. If we are to turning healthcare into an industry, we need regulation. Clinics should be incorporated under the scope of regulatory regime. The government should also look into the form of regulation. Relevant premises should have a doctor in charge for a certain number of hours. This will boost confidence. We should also boost the exchange of talents between Hong Kong and other GBA cities. We need to provide doctors from the mainland with sufficient training on language, on work procedure, workflow, operation of equipment, so that they'll be fully prepared. They can come to work to alleviate the workload of Hong Kong. This will deepen exchange as well.
Mr. Peter Sher. Thank you, President. I think it's common knowledge that we have an aging population in Hong Kong. Senior citizens have greater reliance on healthcare services. I'm not referring to just smokers, but non-smokers as well. We need to find a way out. Professor Low has shown great commitment since he assumed office. And on healthcare reform, there have been divergent views in the community. For example, the A&E fees will go up to $400. There is a question whether the grassroots will be left out of this safety net. But I think this is the right way to go. Because if the A&E fees are set at such a low level, you attract a long queue, and those in genuine need may be deprived of the chance to get treated. So the government should remain steadfast. Say if $400, I think this level is acceptable. In terms of drugs, again, this is one major reform direction. In the past, people might take out a big bag of drugs from the pharmacy in one go. Now it will be done in a different way. Patients will need to get drugs on different occasions, and that may help prevent the resale of drugs. The third point is about medical insurance. We have many medical insurance policy holders in Hong Kong, but very often these policy holders would in turn go to public hospitals instead. They may not want to claim their own insurance. This is because they do not have confidence in whether there is full coverage. If they're able to have a better idea whether there is a full coverage, they will be assured, and then they will rather go to a private hospital. So I support Dr. David Lam's motion. In fact, according to private doctors, business is not as good as before. But there is still an imbalance. There are long queues at public hospitals, but some general physicians in private clinics do not have a lot of business, so we need to do something about the policy. As mentioned by Mr. Jimmy, this friend who is a middle class may still need to pay for ultra expensive drugs. I've heard of so many such cases. These medical expenses eat into their savings. A single injection will take more than $10,000. Now, many people have turned to Shenzhen because of the national procurement of drugs. The cost is lower. So, Secretary, you should talk to the country and see how we can lower the cost. Mr. Tommy Cheung has been facing a lot of pressure in advocating for non-locally trained doctors to practice in Hong Kong. This issue is controversial. In the end of the day, his efforts have been recognized because we are short of doctors in Hong Kong, especially specialists. Now, we have more doctors, but we can't catch up with the demand. More should be done to ramp up our capacity. 2 days ago, I met a friend working in the public. I met a friend who is also queuing up for an eye check in a public hospital. He expects to receive the cataract operation after 3 years. After Dr. Dennis Lam has spoken, I will invite the mover of the motion to speak and respond to the amendments. Dr. Dennis Lam. I thank Dr. David Lam for moving this motion. Now, I work for an organization that provides healthcare services. I need to make a declaration here. Last month, the government explained the legislative proposal to enhance price transparency in private healthcare sector. Fee schedules should be provided according to a specific format, and budget estimates should also be provided. The private healthcare service providers should also publish the historical data about the fees and charges. I support all these directions. It will turn the whole system transparent. Patients will have a full grasp of the treatment fees involved. This will curb unnecessary bickering and restore public's confidence in healthcare services. At the moment, there is not a standardized approach to handling claims by insurers. Different organizations have different pricing standards. So I think Mr. Pui-leung's amendment should be supported to enhance price transparency so that there is sufficient reference for insurance companies to settle medical claims, and this will help reduce disputes and speed up time for handling claims. Many members have talked about packaged charging. I think what sparks the fear of patients is not just fees and charges, but possible complications that may happen after surgery, and because this may entail expensive charges. So apart from itemized and standard charging, a package should be made available to patients to be given additional coverage on complications. After the launch of the voluntary health insurance scheme in 2019, things have changed. The original intention is to provide tax incentive and institutional safeguard to encourage members of the public to opt for private medical services so as to ease the pressure on public health care. My suggestion is that we should continue to provide greater tax allowance for taxpayers taking out VHIS. They get an annual tax deduction of $8,000. According to the marginal tax rate of 17%, the actual savings amount to $1,360. For senior citizens, the premium for VHIS could be as high as $30,000. So the tax incentive is not good enough. The second point is about high-risk insurance or reassurance. More should be done to encourage those with chronic illnesses to take out insurance policies as well. At present, insurers may turn down the applications of the chronically ill or those with high risks. They can't get insurance coverage. According to data in 2024, for those aged 60 or above, only 12% have signed up for VHIS. There is a lot to be decided. The third point is about medical insurance. Under the standard plan for cancer drugs, An annual allowance of $80,000 is allowed, but the cost of cancer drugs far exceeds $80,000. Finally, the government does not require employers to take out medical insurance for their staff. I hope this can become a policy. More incentives should be provided because we have an aging population with more people having chronic conditions. There is a greater pressure on public health care. We have multiple challenges. It is important to set up a risk-sharing mechanism so as to ensure the sustainability of the healthcare structure in the long term. I support the motion. Dr. David Lam, you may now speak on the amendment. Mr. Edward Leung's amendment involves additional provision of evening consultation services and higher price transparency. Along with this member, I am also concerned about price transparency and predictability. Now, my suggestions are as follows. A centralized platform should be set up for members of the public to search about the pricing as well as the treatment for various chronic illnesses. Institutions can also upload historical data on fees and charges as well as claim amounts. The time limit for processing claims should also be set so as to ensure price transparency and certainty. Mr. Bill Tang refers to encouraging the health record sharing between public and private healthcare institutions. I believe the bill will be passed in due course, and definitely this can help solve challenges facing frontline officers. Now, I'm happy to be the go-between as well. Mr. Tang also proposes a mediation mechanism to handle disputes. Now, the mediation service is available, but we do not have a policy to promote this objective. As for mandating private healthcare facilities to provide all medical items at packaged charging, I do have reservations. Now, not all prognosis are predictable. For example, some may have attracted pneumonia and 3 days of hospitalization is required. Some conditions may deteriorate and may require ICU and hospitalization for several months. Packaged charging has its merits. It's also the trend. It provides price certainty. Before the co-payment model is properly adopted, we can allow itemized charging for us to compare the latest technology and the equipment. For package charging, we should allow patients to choose the package with the similar content and similar pricing. Otherwise, it's not an apple-to-apple comparison. We're not adopting the concept of a buffet, so we need to be careful about package charging. Dr. Hoey Simon Lee refers to promoting various healthcare financing sources, including a family medical savings account. This is similar to what I mentioned in my opening remarks. This should not involve a significant contribution, and it's an emergency sum of money for the grassroots. Mr. Pui-leung refers to medical inflation. In the past 10 years, excluding the expenses on COVID, the total medical spending increased by 92%, especially for public healthcare spending. It rose by 109%, far exceeding the 74% growth for private healthcare. Now, the medical inflation comes with various reasons. We have some solid demands, but also other forms of demands. For example, we have new challenges as a result of demographic changes, such as the prevalence of heart disease, stroke, cancer, and the various treatment procedures, additional expenses on these diseases. The chest pain clinic should help the IMAs Institute for Medical Advancement and Clinical Excellence will draw up protocols for common diseases. It will provide clinical pathways and designate necessary procedures under certain conditions. This will be an objective reference for doctors as well as the insurance sector. I thank members for the amendments, and other members have spoken.
Secretary for Health. President, I thank Dr. David LAM for proposing this motion on comprehensively promoting healthcare financing reform and making optimal use of public and private healthcare resources. I also thank the other members for their amendments. Just now, 42 members have spoken. This shows that we all care about the sustainable development of Hong Kong's healthcare system. Over the past few decades, it was hard for us to advance the reform. There were rounds of public consultation and proposals, and Dr. David LAM pointed out why we remained stagnant. So this shows that we need to be determined to come up with a policy. We have to take into account the interests as well as health of our citizens. As mentioned in my opening remarks, we need to consider the three medical linkage in healthcare, medicine, and health insurance. Healthcare financing is an important part of it. From today's discussion, we see that we face huge challenges in our healthcare system. We have to continue to strengthen our work in prevention so that we won't focus too many of our resources on medical treatment. We need to prevent the public and private healthcare systems from going to the extremes. Now, PPP stands for Public-Private Partnership. However, the third P doesn't represent partnership in our case, but polarization. This is the most obvious in the level of fees charged in the public and private sector. Public services are too cheap, and for private services, they are very expensive. So even those with insurance coverage, they are hesitant whether to use private services. So we need a dual-track approach. The two tracks should move at the same time instead of and should move towards the same direction instead of having them go different ways. We need to deal with the increase in healthcare spending. We need to address the imbalance to ensure the sustainable development of our healthcare system. Today's discussion covers a lot of areas. Let me respond to some of the major issues raised. Now, at the opening of the debate, there was mention about the need to have a healthcare financing reform. Healthcare financing reform is an important part. But the government subsidizes 97.6% of the public healthcare services. This is kind of like an insurance for people. Well, some members have raised some suggestions and comments. All along I've stressed that this fee adjustment is a reform brought out by the government. Therefore, I'm disappointed to hear that some members said this is an increase in fees and that we're doing it closed door. I disagree. I hope that members will pay attention to the situation over the past 25 years. We have already conducted consultation, so there is basis to our fees reform. And one of the major points of this fees reform is that we have proposed 3 ways to strengthen our safety net. For example, there will be a reduction mechanism. Currently, only 600,000 people can enjoy the fee waiver mechanism, and the number of people will be increased to 2 million. That means 1/4 of the population in Hong Kong will benefit from the fee waiver system. Also, we are setting a cap to $10,000 to protect those suffering from serious illnesses and those who have to pay for expensive medication. We have to strengthen the protection for those suffering from serious illnesses. We shouldn't have a safety net that benefits those who abuse the public healthcare services. We need to do a lot of explanatory work. I hope members will pay attention to the details of our reform. We have 3-level protection in place. We're not simply increasing the fees. I hope members, after learning more about our reform, they will help promote the reform for us. I've visited some districts. I have also talked to all district councillors in Hong Kong. I hope that at the district level I can explain to the public about the vision behind our reform, as well as how we're going to operate the scheme. Now, this scheme will start running from the 1st of January next year. And the application procedures will be streamlined. We are expanding our services by offering evening consultation services, as well as holiday consultation services. As to the point about offering 24/7 consultation services, well, this will incur extra costs and resources. Well, the cost will go up compared to daytime outpatient services. We had private doctors offering consultation services at the A&E department, but there weren't enough patients, and again, this would boost the cost. Dr. David LAM offered some very good suggestions. He compared our system with that in Singapore. There's a community assistance scheme in Singapore. There are 5 levels to the system. We've analyzed the different healthcare systems around the world. We understand that each country faces different problems. We think that others are doing better, but others also think our system is better. With one ID card in hand, you can ensure that you have access to healthcare services in Hong Kong because we have a robust safety net. In the event of serious illnesses, you can, with a very low cost, have access to healthcare services here. We will also at the same time learn from successful models in other places. Now, there are different ways suggested to fund the public healthcare expenditure. For example, MPF contributions. Well, the MPF scheme was set up for a purpose. The aim is to ensure long-term investment so that it can help people save up money during their career. And when people retire, they'll be able to withdraw money from the fund to take care of their needs in daily lives. If people are allowed to withdraw the money early, It may affect their quality of life after retirement. This runs counter to the original purpose for us setting up the MPF scheme. Now, on the suggestion concerning the elderly healthcare voucher scheme, the purpose of the scheme is to allow elderly people to make use of the vouchers to get basic services from the private sector at the primary healthcare level. It is not for inpatient or services. We have more participants under the elderly voucher care scheme now. If we expand the scheme to fund the healthcare spending, this will affect the sustainability of our healthcare system. Again, this runs counter to our original purpose of setting up the healthcare voucher scheme. Some suggested that we can set up savings accounts for people to settle their healthcare expenses. I think the advantage of this plan is that we can prepare for the rain and to have enough savings to deal with the healthcare expenses when we get old. This also is in line with the user's pay principle, and it can teach people to be responsible for their own health. By setting up this account, you may be more careful with how you use the money. However, this may not facilitate risk pooling. For those who suffer from chronic illnesses or severe diseases, they may not be able to shoulder the exorbitant prices for healthcare services. Now, I'd like to turn to the voluntary health insurance scheme. In 2019, we launched the scheme. And over the past 25 years, where we had discussions about healthcare financing, we came up with this proposal of establishing the VHIS. It was launched in April 2019. Afterwards, we had 3 years of COVID, and COVID affected our implementation of the scheme. However, as at the end of last year, we've had about 1.43 million insurance policies issued under the scheme, and this account for about 20% of our total population, although some people may have more than one insurance policies under the scheme. Now, over half of the insured, that is 53% of them, are below 40, and 32% of them are below 30. And this is a very good phenomenon. This shows that young people start taking out insurance when they are young. This is in line with our vision, because this will offer protection for people, and when they get old, they will be financially capable of shouldering the cost. Now, there are certain characteristics to the VHIS. You can get covered until you reach the age of 100 years. There are 20 days of cooling period, and there is price transparency under the scheme. Now, your benefits will be continued until you reach 100. That means insurance company will not increase your insurance premium because you have made claims before. And the insurance premiums are adjusted based on your age and your gender. So your insurance premium will not be raised at an unreasonable manner just because of your own health condition. So the amount of premiums you pay is comparable to those who suffer from serious illnesses. Now, the coverage scope include congenital diseases, as well as daycare surgeries. and non-cancer treatment. This is crucial. Insurance companies that take part in the scheme, they also announce publicly the level of insurance premiums charged, and all this information is set out in the one-stop platform. Now, about the setting up of a risk pool. For those with known diseases, their health conditions are more complicated, and most of them opt to receive treatment in the public healthcare system. Some ask whether we should use public money to help these people take out private insurance. Well, we have to be prudent in terms of how we use the public money to help those with serious illness deal with their healthcare needs. Now, Dr. David LAM made another suggestion. He talked about hospital beds, and Mr. Martin Liao also mentioned a similar point. Indeed, there are 4 positionings for the public healthcare system. We're not only taking care of the underprivileged as well as the low-income group. For those suffering from complex and serious illnesses or urgent conditions like those who got injured in traffic accidents, they should be taken care of too. 90% of people in Hong Kong, they opt for services from the public hospitals. So those who can afford the services, they also visit the public hospitals. It's not just because of the low fees, like urgent conditions, organ transplant, and newborn babies who were sent to the ICU, as well as COVID. They're all taken care of by our public hospitals. So for those who are more financially capable, can they abide by the affordable users pay principle to take up the cost for using the public hospital beds? We know that 1.4 million people take part in the VHIS. So can we make use of the insurance for those who need public healthcare services? We will study this. Now, packaged charging is part of our legislative proposal. We are promoting package charging in the private sector. It has its merits because it can control the cost for receiving treatment and health checks in the private sector. Now, Dr. Lam suggested that there could be a buffet-style charging. There might be situations where you, for example, go to a buffet and there are many choices or food available, but you do not need so much food. There are also suggestions that we can adopt the omakase approach for fee charging. But if we charge patients for each item, patients may get a very long bill. There might also be conflict of interest. If we adopt omakase approach, instead of charging patients for each item, it may work if it is good for patients. However, there are many things that cannot be foreseen, such as complications suffered by patients. there may be unexpected situations, so it is not easy for us to roll out packaged charging. President, I thank members again for their valuable views. They talked about healthcare reform from different perspectives. Healthcare is an issue that has to do with our lives. It is a complicated issue, and the interests of different stakeholders are involved. The SAR government will continue to forge a consensus and work with all sectors to build a balanced, efficient, and sustainable healthcare system for a healthier future for the people of Hong Kong. Thank you.
I now call upon Mr. Edward Leung to move an amendment. President, move my amendment and propose a question to you that Mr. Edward Leung's amendment be passed. Will those in favor please raise your hands? Those against, please raise your hands. I think the question is agreed by a majority of each of the two groups of members present. I declare the amendment passed. Mr. Bill Tang, as the previous amendment has been passed, you may move your further amendment. President, I move my further amendment. I propose to question to you that Mr. Bill Tang's further amendment be passed. Mr. Tommy Cheung claims a division. The bell will ring for 5 minutes.
開始表決。
Voting begins. Members, please check your votes. If there are no questions, voting is closed. The results are displayed. From ECs, 36 present, 5 for, 8 against, 23 abstentions. From FCs and GCs, 44 present, 5 for, 13 against, 25 abstentions. The question is not agreed by majority of each of the two groups of members present. I declare the amendment negative. Ms. Starity. President, I move that in the event of further division being claimed, in respect of the motion on comprehensively promoting healthcare financing reform and making optimal use of public and private healthcare resources, this council proceed to divisions immediately after the bell has been rung for 1 minute. I put this question to you. Those in favor, please raise your hands. Those against, please raise your hands. I think the question is agreed by the majority of each of the two groups of members present. I declare the motion passed. I declare that in the event of further divisions being claimed on the motion on the above motion, this council shall proceed to immediately after the bell has been rung for 1 minute. Dr. Hoey Simon Lee, the amendment, you may now move your further amendment. President, I move my further amendment. I put the question to you that Dr. Hoey Lee's further amendment be passed. Will those in favor please raise your hands? Those against, please raise your hands. I think the question is agreed by a majority of the members present. That is, I declare the amendment passed. Mr. Pui-leung, as amendments have been passed, you may move your further amendment. President, I move my further amendment. I propose the question to you that Mr. Pui-leung's further amendment be passed. With those in favor, please raise their hands. Those against, please raise their hands. I think the question is agreed by a majority of the two groups of members present. I declare the amendment passed. Dr. David Lam, you have 37 seconds to reply, then the debate will come to a close. Dr. David Lam. The government has been taking steady steps to undertaking healthcare reforms in this term. They're heading in the right direction. I hope that the members of the public will have greater confidence. Doctors also support enhancing price transparency. For unforeseen circumstances, doctors will always put patients' interests first. It doesn't mean that pricing should be opaque. So with the help of the government, I urge members to support the motion. And I put the question to you that Dr. David Lam's motion as amended by Mr. Edward Leung, Dr. Hoey Lee, and Mr. Pui-leung be passed. Will those in favor please raise their hands? Those against, please raise their hands. I think the question is agreed by a majority of the two groups of members present. I declare the motion as amended passed. The council is suspended until 11 a.m. the 18th of June.